it last night, and it's the ISI.
ISI. Okay, thank you so much, Evelyn.
You're
Oh well.
welcome. Yeah, because based on that INR, it's for PT, so it rings a bell about the thromboplastin. It's a different clotting factor. So it's ISI, International Sensitivity Index.
Okay,
It's the
thanks a
correct
lot.
answer. Yeah,
Thank you.
you're welcome. Nice hair, hasn't it?
Thank you.
Really good.
I'm trying to grow with it. It's my first time doing this one, so
Yeah,
yeah, I'm trying to grow with it. So we'll see.
yeah.
We'll see how it is.
Actually, it's the curly one.
Yeah,
Yeah.
I think
It's
it looks better, the curly one.
yes.
I like the
And
curly
look at the
one.
color, lavender, eh?
Yeah, I like the curly one.
Yeah.
So we'll see. We'll see about this one.
Mm-hmm.
Yeah. Oh well, it's one of those. Oh Lordy, Lordy, I'm tired.
Yeah. Me too.
Me too. Me
Yeah.
too.
Everyone,
Yeah,
eh?
Yeah,
I'm
he's so
like
tired.
yeah, I'm tired like crazy. But it's one of those. Well, this too will pass.
Right. It will
Right, let
pass.
us. I'm gonna go through another other questions and see what I can come up with because there's some that have the question mark. Let's see what we can work on.
Mm-mm.
As a first page, remember that one. What is the following factor can affect the ESR rate?
Is that in the final review?
The final, I put decrease in the plasma protein. I think that's right, though. I have a question
Yeah.
mark there, but I think it's right.
Yes, we're going to ask mom about that.
Oh, okay.
Good morning, everyone.
Good morning.
Good morning,
Good
ma'am.
morning, ma'am.
Good morning,
Okay.
ma'am.
Good morning.
Can't believe it's snowing on the outside
Yeah,
last
can
night.
you imagine? When
It
I'm
is
coming
spring
home in the
day.
morning, it's snowing. It's so
Yeah,
irritating.
Yesterday
yeah.
was the first day of spring, but it is
Yes, ma'am,
snowing
that's true.
hard.
Yeah.
Yeah.
Evelyn, are you tired today?
Yes, ma'am, I have a mild migraine.
Migraine, it
So
looks
I'm
like. You never, yeah, it looks like.
yes. So, but I'll still be here. I'll be
Yeah, I know,
listening.
I know, I know, I know. You're always, yeah.
Thank you.
Try to take it easy, okay? So,
Yes, ma'am. Thank you.
yeah, yeah. Who is still not here? Alexia, Senate, Amina, please. Kara is not going to be here today, right? Kara is on court.
Yeah, yes, ma'am. But she might be hearing.
No, but if she doesn't can come to the
Possible.
camera, that's going to be problem, no? Regarding the
Yeah.
attendance, for the other things, it doesn't matter.
Oh, yes.
Because nowadays they check the attendance very, so if she, like if you're in the car, even showing your face, I can do the attendance, but without the anything, it's so hard.
Mm. true.
But she's okay. She has a good attendance, so I don't worry for her. Let me do two things and then I will do this one. This one and then this one. Okay. Uh, mhm. This one is done. So this one needs to be done. I'm so tired. The campus lobby, this one live, this one Anderson email. I have to go to Anderson email to go to D12. Hmm. Files. That's so next okay. So who is not till present 15 people? Evelyn Posardo Huda. Examina Asmat Keys, Evelyn Huda, Mina Luis. Senat. What happened to Santiago? Santiago is not here. Rubiato is not here. Christiana is here. No, I don't see Christiana. That they're doing the review. So let me do the attendance, and from there I can understand who is here and who is not. Again আবার কি পড়ে গেল? Huda,
Present.
Christiana, Yusra,
Yes, present.
Amina,
Present, ma'am.
Igong,
Present, ma'am.
Alexia,
Good morning, present.
okay, Zinaida,
Present, ma'am.
Bazardo,
Present, ma'am. Good morning.
Santiago.
Present, Miss.
Oh, you just came in. I didn't see you
Yeah,
before
no, I
the time.
couldn't see the link.
Okay. Joanna,
Here, ma'am.
okay. Chris,
Here.
Cara is absent. Santiago is present, right? Joanna is present. Cara absent. Savannah said she will be little late. Asnath is present. Luis,
Present, yes.
Yes, ma'am. I'm here.
okay. Evelyn is there. I saw Rugiato.
Yes, ma'am.
Rugiato, absent. Maris,
Yes, ma'am. I'm here. Good morning.
Parna,
Present, ma'am. Good
Parna.
morning. Good
Okay.
morning, ma'am. Yes.
So then Shabana, Christiana, Rugiato. What happens to them? I don't understand. They told them so many times in the watch, attendance watch. Christian absent, Rugiato absent. Sabana late. She said she's going to be late. Okay, so 2 more days, okay? Tomorrow, it's the exam. Tomorrow, what time you guys want to do the exam? 10? That's fixed, right? Because between Amina and Santiago, it's 10 or 10:30.
I was gonna tell you that I think Santiago has an appointment, right?
Yeah, Miss.
Santiago
So
told, yeah.
some Yeah, so my appointment is at 9:30. 10 is a little tight, but 10:30 I should be good to get here on
Okay, so
10:30.
10:30, Amina, 10, okay, let me see how long is the exam, okay?
Is this the one that is like an hour or
That's
how
I
long?
have to see. That's I have to see.
Okay.
It is 1 hour exam, okay? Everybody got it?
Yes, ma'am.
Six-
Yeah.
10:30.
60 minutes. So 6:30, 10:30 to 11:30 is works for everyone.
Yes, ma'am.
Amina?
Yes, ma'am.
Yes, ma'am.
I'm
It
good.
works. Thank you.
Okay.
Yeah.
So then we figured it out. So we are going to be to start at 10:30, 11:30, and you will have enough time, Amina, to go to doctor, right? Okay. So it works for Santiago. It works for Amina. Good.
Thank you, ma'am. Yes, ma'am.
Go out from here then. Hematology fundamentals. 5 to 6. So, okay, so now this 6. How to go to the next one? Oh, 7, this 7 to this the 8. Present, 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 present. Service status associate to the NS and present. So day 7 is going to be day 8 now. Day 8. Oh, day 8. The 8. Buddha is present, Isra is present, Amina is present, Passionate present. Ying Hang, present. Alexia, present. Zenaida, present. Pozzardo, present. 3 plays I have to do the attendance now. Can you imagine? Joanna, present. Chris, present. God absent today. Okay. Luis, present. Evelyn, present. Lugiato, absent. Mary is present. Bhilles, present. Okay. Let me see whether the Rugia is still there. So basically, Christiana, Rugiato, and Savannah is not here. Okay. Savannah so far absent. When she's going to come. Open in Excel. Then we can close this one. The team, close. Okay. So again, ECG final hematology review test 2. Test 2, hematology test 2, editing. Open in desktop. Okay. Okay, so and next one thing, close file, and then finally do it answers. Down, editing, open in desktop.
Yes, Mom.
Yes.
Morning, it's Asenet. I have a 11 o'clock appointment this morning, but I'll be on camera.
Okay.
Thank you.
Okay. What is this one? Test 2. Okay, so you want to go now with the reviews quickly? Or you want to wait?
Yes, miss, we can go for the review.
Yes, you can go. Start now.
Okay. Okay. Which one you guys have question? That's you guys told me that you guys told that you guys are okay with the other answers. Only whatever your confusion questions. Test 2. Page 1, anything?
Nothing on page 1.
Page 1, what is the answer for the first question?
B.
Okay. Next one?
A.
Calcium.
Ossia.
Okay, next one?
Human blood, which is A.
Good. Next one?
Thrombosis.
Thrombus.
Thrombus.
Yeah, which is
Next
A.
one.
Yeah.
Don't get confused because right
Yeah.
now you have the turn. When is which
Yeah.
travels embolus?
Yeah.
Yes.
Okay, that is the blood clot which travels in the embolus. Any blood clot is called the thrombus. Okay, this you have to make it. Clot
Yeah,
breaks away.
I'm having a problem pronouncing these words.
That's okay. You have to practice it. So make sure when there is anything, questions come in a tricky way, any blood clot which can breaks or travel. It can say the which term is used to when a clot breaks away and floats. It may not give you breaks away. It may give you the describe when a clot floats freely in the bloodstream.
Float. Yeah, float. Mhm.
Float, which the clot, which is that is the more dangerous thing because it can go anywhere in your lung, heart, and it can clog and make a blockage total. So embolus is more threatening than the thrombus. Thrombus
Good
stays in
morning.
one location. Thrombus in one location. Clear? Make sure
Yes.
the clot breaks or the which the blood clot flows is embola. Okay. Next one, everybody knows the answer. After embolus,
Yes, ma'am.
Hemoglobin,
Yeah.
following. This one
white blood
everybody should
cell,
know.
white blood cell platelet.
B, right?
B.
The B.
Is there any question in the page 2?
Yes, ma'am.
Which one?
Yeah.
Now remember the plasma
Plasma
protein that functions in blood
Fibrinogen,
clotting.
fibrinogen.
Only, yeah?
That is the, yeah, fibrinogen is the protein.
Yes, ma'am.
And yeah, yesterday I talked about that because I just
Yes,
did the
ma'am.
search. Yeah,
Yes.
fibrinogen is the protein and fibrin is formed. And from the thrombin, through some reaction, fibrinogen is formed. That is in the plasma. Okay? So fibrinogen is the plasma protein which helps in blood clotting. Okay?
Okay, ma'am. Thank
Okay,
you.
next one also we answered yesterday if I remember, hemophilia.
Yes.
Factor 8.
Factor
Okay.
8.
And also we discuss about the process of clotting and stop bleeding. Bleeding stop, hemostasis. And how the blood clots through the coagulation process. Okay?
Yes. Okay.
Ma'am, you can call that process of clotting thrombosis also, right?
What?
You can call coagulation thrombosis.
Thrombosis, when there is a formation of some thrombus, then it's called the thrombosis. When there is a hematoma kind of thing, then it's the thrombosis.
Okay. So it's not a
But that is
term
not the
for-
process. That is not the process. That is the name.
Okay. Thank you, ma'am.
Everybody knows which is not a blood type, right?
Yes,
Yes.
ma'am.
Yes.
Yes.
So the next page.
What antigen are present in a patient with A positive blood?
A antigen, that's RH.
Yes.
Okay. What antibody is present in A positive blood?
Anti-B.
Mhm.
Good, very good. And yeah, very good. Now it looks like conception is clear.
Yes.
What antigen has in O blood group?
No antigens.
No antigen.
Which antibody O blood group has?
A
A
and
and
B.
B.
And D.
Very good. Oh my God. Whoo, whoo. I feel so good. It went to their head. Okay. What is the next one? That is the, everybody knows that is the deferred stage.
Yes, ma'am.
C, right?
Yes, ma'am.
Okay.
C.
Okay.
C, yeah.
Okay, C, yeah. Before loading the CVC tube into the analyzer, what should the MLA look for?
All the above.
Clots, tube level appropriate test, sufficient volume. Yeah, all of the above. Okay, next one. Page 3.
What?
Page 3, anything?
Just, do we have anything?
Only one question, ma'am. The hematocrit gives blank.
Pack cell volume. Packs RBC volume.
Thank you. Yeah, that's
Yeah,
our
you guys know
answer,
that.
ma'am.
What is it
Yeah.
gives? It's the packed
Yeah.
volume of
That's our
RBC.
answer.
Yeah,
Yeah, that's, yeah. Pack RBC
RBC.
cell.
Packed
Yeah.
RBC, and this gives the volume of the RBC. Packed RBC volume. It's coming in
Volume.
the volume, right? What is coming
Yes.
packing down? That is the volume. And you guys
Yes, ma'am.
know the hematocrit men 45 to 52%, women 37 to 48%. But sometimes the results are vary little bit 1%, 2% in difference range. Use whatever in your book. Okay, in your
Yeah,
chapter
yes.
or on your Microsoft PowerPoint, use that value.
Yes, ma'am.
Okay,
It's
okay. So
some
yeah.
a little bit variation.
Yeah.
Wasn't it? It's 40 to 54. That's in the book, right?
In the book. What is
Yes,
in our
ma'am.
what is in our PowerPoint? 42?
40 to 54, I think.
% yeah.
Okay. So whatever is in your book, 54. Okay.
Yeah.
Even I didn't remember. Thank you. And for the woman, how much they
36
told?
to 48.
36 to 48. Okay.
Yeah.
Good. I had the 37 to 48 for my knowledge, but whatever your book says, write that. Hematocrit. How you are going to calculate hematocrit from MCV?
It's red blood cell times the MCV.
Mhm.
Over
And by
10.
10.
Divided by 10.
Yes.
Yeah.
Right.
Okay.
We're good with this page.
Okay, so hemoglobin. Oh, you know the hemoglobin concentration of male and female?
Yes, ma'am.
Male is 14 to 18. And
Grams per deciliter.
Yeah, that you have to give the unit, yes. And women?
Yes.
12 to 16 gram.
12
Per
to
deciliter.
12 to 16 or 15, I don't know. It in your book is 12 to 16? In your PowerPoint?
Yes,
Check your
ma'am.
power. Yeah?
Yes.
In your PowerPoint 12 to 16?
Ma'am, this from the copy you gave us last time for the hematocrit.
I know. No, but this time D12, that is the actual things, okay?
Yes, some mom is 12 to 15, but I'm not sure if that was from the D2L.
Okay, just check that one and let me know also, okay? So
Okay,
just
ma'am.
check that one in your D12 what they said, okay?
Okay, ma'am.
Okay. It doesn't matter, but the D12 there will be value. So it says male says 14 to 16. No, male should be 14 to 18, right?
Yes.
14 to 18.
Yes, ma'am.
Yeah, and women should
12
be
to 16.
12 to 16. Okay. So you guys know platelet count. What is per millimeter?
150,000 to 400,000 per millimeter.
Neutrophils percentage?
50 to 70%.
You are looking, are you telling me or you are looking at review and telling me?
Looking the review to be honest.
So you will be able, you'll be able to remember if the all the values can.
Yes, ma'am.
Okay.
Yeah.
You will be able to remember.
I'll try to remember. Sorry.
Well,
No,
yes, ma'am.
they may ask you the question. That's why I'm just asking, right? Okay.
Yeah.
I'll go through. I will ask random question later. Let us finish whatever you guys did in Alpha. Prothrombin is that you become able to answer. What type of
Alpha and beta. Alpha globulin
and
produced by the liver.
good.
Liver.
What is the hemoglobin for infant?
15. G.
That we have different answers, ma'am.
Yeah, we have a question for that. I have the 15.
To my knowledge is 14 to 22 gram per dl. Okay.
14 to
22 gram per dl. Write it down. If there is any discrepancy in D12, we will fix it later. From my knowledge or from my readings, is 14 to 22 gram per liter. Okay. You are going to put a
yes.
yeah. If there is any if there is any discrepancy, we'll see. Okay. Blood is composed of what percent of plasma?
55.
55%.
And how much is the plasma?
45. 55, sorry.
55%.
Yeah.
And what percent is leukocyte and what percent is Bapicoat?
1%.
What is the composition of the Bapicoat?
WBC and
platelets.
Okay, good.
But the Bapicoat is supposed to be less than 1.
Yeah, just it's
variable.
hard to so it's variable. So in general, they formulated it that it's so less that you can see 55% or 45%. So it's 100%. So 1% is less. That doesn't count,
Yes,
but in
less
general,
than
there is a Yeah, actually, so it's going to be 1% and it's less than 1% or 1%, whatever the questions has the best answer, give it to that. And obviously it is composed of WBC and platelets. Okay. So if I take the, collect the blood in a sodium citrate anticoagulant tube, keep it at 15 minutes or 30 minutes and then centrifugate, what I am going to get? Alexia. How is going to separate? I am taking the blood in a sodium citrate anticoagulant tube. What is the first tube color, Alexia?
It's light blue tube.
Okay, and what sample you are going to get?
And you're going to get whole blood sample.
What sample?
Whole blood.
No, I'm going to get the whole blood in the sodium citrate tube, that is the light blue tube, and then I'm going to centrifugate. How is going to separate?
You're going to get plasma, buffy coat, and red blood cells.
Very good, very good, very good. So all are plasma separated tube. Okay, so EDTA tube, light blue tube, mean tube, what is called Tolping tube, all can separate into plasma because they have the anticoagulant. Only the serum tube or the SST tube. What is the another short name of plasma separated tube?
PST.
PST.
Yeah,
And
yes.
SST stand for?
Serum
Separated tube.
Okay. In high altitude, the hemoglobin value will be
Increase.
Hi.
Why?
or higher or increase. Why?
because of
Why?
the polycythemia.
Because of the overproduction of hemoglobin.
Obviously, there will be production of hemoglobin, but why hemoglobin needs to be produced there?
Because of low oxygen.
Because of low
Low
oxygen and then
Yeah.
Low oxygen. So
Oxygen.
low oxygen, they will need more blood cells and more hemoglobin. So there will be also increased for producing the hemoglobin. What you have to
RBC.
make RBC? What is the name of the procedure for the RBC production?
Erythropoiesis.
Erythropoiesis. Which hormone is going to be secreted that time?
Erythropoietin.
From where it is going to be secreted?
Kidney.
from the kidney.
Kidneys.
Okay, very good. Very good. Next one, what does an automated CBC analyzer measure?
You have given the answer, ma'am.
It's answers.
Yeah. What
It's
are the answer?
highlighted. Red
I
blood
already
cell.
give the answer. Oh, okay. I know. Okay. Okay. Number of pulses equals to?
Number of
Number of
cells
cells.
counted.
Remember this one. Right now you are looking at the review. Without the review, when you are going to see, when then the number of pulse means how many times is giving the pulse is going to give you the number of cells. And height of the pulse gives you the volume of the cell is called the MCV. Okay, so we are going to get the cell count depending about the number of pulses in the automated analyzer. And volume is the height of the pulse. Pulse is how many times is hitting, and pulse is how many times is giving the deflection, the up. So that is the height. INR?
International normalized ratio.
Okay, just give me a second. Rugiato is here. Rugiato texted me.
On here.
Yeah, no, you are not there, so that's why I just let me update that things. Okay, let me update the attendance. Rugiato is here. It's 9:44. Rugiato is present. Okay. Sabana is still not here, right?
She has a message, ma'am, on the chat.
No, ma'am, I'm here.
She
I was
told
here at
you are
Yes,
here
ma'am.
already?
yeah,
Sabana, you are here?
I was here at 9:20. Yes, ma'am.
Okay. Okay.
I sent a message in the group
Okay.
chat.
Okay. But that time probably is okay. Good. Sabana is present. Okay. Only Kara is absent. And who is that? Kara is absent and Christiana is absent. Christiana has no message, right? Christiana didn't send any message? I didn't see her any message.
No, ma'am, I
So
didn't
far,
see
ma'am,
any.
no.
No? Okay. That's why I thought. Okay, let me just corrected it. So, present, what is Mary is present. Okay, so Rugiato present. Sabana is present. Okay. So Kishana is still not here. So 9:46. So I have to keep it absent and I have to close it. Kara and Kishana, I still kept it open, but I have to keep it absent. Save. Okay,
Sorry.
take attendance. Okay, so Kara is absent and Kishana is absent. Okay. Okay, all are updated now. Good. That is maintenance. So Sabana and Rugiato, you guys came late. So I just like to let you know whatever we discussed. We are going to have your exam tomorrow, hematology, test number 2 from 10:30 to 11:30. Okay. Everybody will be on team for 9 a.m. as usual. You do your studies and other things. I will give you the password at 10:30 and you are going to be done by 11:30. But after you done in 11:30, stay up to 12 at least in the team. Okay. Before you leave. Okay.
Okay, ma'am. Yep.
Okay.
Okay.
Okay. Okay. Yeah, so this one is done also. Let me close this one. And then I don't have too many windows open. Okay, so good. And then what now? Okay.
Miss,
Yes.
for the height of the pulses represent,
Yeah.
is that the size of the cell or you said the height of?
Height. How tall? How tall?
Height of. Okay, thanks.
How
Okay,
tall
thanks.
is the spike? That is the height.
Yeah.
Okay. And that
And it's
will
the
tell you the cell
LCD.
volume. How
Yeah.
big is the cell?
Yeah. Thank
Okay.
you, Miss.
Okay. And how many times it hits the pulse, it gives you the cell number. Okay, so where do you are now? Okay, so page number 4. Okay, so this one, you know, if coagulation is prevented in a blood tube, centrifuging will separate the cells. Coagulation is prevented in the blood tube. Okay, so what is the answer?
Plasma.
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 If coagulation is prevented, coagulation means that it's not getting coagulated. See, the questions are really tricky. So the coagulation is prevented means there will be no coagulation. Central separated in the plasma. Yes. What is the function of the fibrinogen?
Yeah. Forms fibrin which binds together platelets and other coagulation proteins to form a plug.
Yes. So that's why I told fibrinogen is a plasma protein which helps during the coagulation process. It forms the fibrin. Fibrin is the fiber. That is called the fibrin. A fibrinogen is a protein which helps to formation of the fiber called fibrin. And these fibrins bind together with the platelet to make a mesh, like a network of mesh. And then all the platelets and all the BWH factors and everything, adhesive protein, collagen, everything is come. And then ultimately a form, that is the coagulation proteins to form a plaque. Okay. Okay. So next question you don't need to answer, or you know the answer. What clotting disease or disorder is where all the clotting factors are used up and patients are severely hemorrhagic? What is the answer?
B.
Disseminating.
No. Hemophilia.
Hemophilia.
Oh, okay.
That's where we have the question.
That's where, yes, ma'am, we have confusion
Yeah. Again, to my knowledge, is hemophilia. If something comes different, we'll see. We'll
Yeah,
get the
because
mark.
hemophilia is inherited bleeding disorder.
Yeah, that's why I
Because
said the used up and patients are severely hemorrhaging.
yeah, that's the keyword, ma'am. Severely hemorrhaging.
Yeah, that is the hemophilia. When there is a keyword severely hemorrhaging means hemophilia. Okay.
All right.
So next one.
Thank you.
Thank you for that one because we.
Yeah.
No. Also, to my knowledge, again, I'm telling is hemophilia. If something else comes in the D12, we are going to correct ourselves. And you are going to get a mark because, but we will correct ourselves and I'll give you the final one. Okay, final with the
When I
answers. But
was
to
reading,
me, it's hemophilia.
when I was
Yes.
reading this particular hemophilia and this disseminating intravascular coagulation, it's what the way it explained it was okay. Hemophilia was something missing, one of the clotting factors missing, so clotting cannot happen.
Yeah,
It was
that's a non-stop
genetic
bleeding.
production.
Non-stop bleeding. Yeah, that's
Yes,
a non-stop
but
bleeding.
it's not that all the like something triggers clotting, the clotting factors to be used up. That's how it explains the disseminating intravascular coagulation. It triggers all the clotting factor to be used up, and the person will just start bleeding for no reason. It's not that a factor was missing. All the clotting factor was used up, like something.
Yeah. It is something is severe hemoglobin bleeding or something like that. So everything used up. But
Yeah, that was how it explained the
it's a controversy. But as per I don't know, to me it looks like hemophilia. But disseminating intravascular coagulation also has the probability. But I'm not sure this one too. Let us wait for the exam. Okay.
Okay, ma'am. Thank you.
Okay. Whatever the answer come, if you get the hemophilia, you will get the marks. If you write the disseminating intravascular coagulation, we will get the mark, but we will correct ourselves, which D12
Thank you,
wants.
miss.
Okay?
Yes,
Okay.
Yeah,
ma'am.
that was a big confusion.
Yeah,
Actually,
because it looks like that to me, I gave the answer hemophilia. Okay?
mhm.
But what Amina, I didn't read that much about that one. But what
Yeah.
Amina is telling, if it is like that, it can
Use
be
that.
also that also. It can be also used that. But what clotting disorder?
Use
But
that.
one thing is that, okay. Here
All the
is the clue.
clotting.
No.
Yeah.
What is
It's a
the
disorder.
disorder or disease?
Yeah.
When it is used up, it's not a disease. Right?
Right.
It's not
Yes,
a
ma'am.
disease. It has this situation where it's severe bleeding, everything has been used up. What I
because
am analyzing.
there won't be any homeostasis again. It will not be able to maintain the blood to, that homeostasis of clotting
That is
and
it, but that is
hemorrhaging.
not that. But that is not the disease. It said what clotting disease or disorder.
Yeah.
When clotting, that is the clue, I guess. Disease or disorder. That can give you when clotting, when all clotting factors are used up, patients are severely hemorrhaging. What is the situation? That may be more suitable for the disseminating intravascular coagulation.
There's even a
That's
particular
right,
picture
ma'am.
of a patient with blood accumulated in the abdomen, like under the skin, it's color purple or something. When it was explaining this DIC in the D2L.
D2L.
Yes, it explained
Yeah.
that something triggers all the clotting factors to be used up, then you will just start bleeding for no reason.
Right.
So hemophilia is a genetic disorder where a factor is missing. It's not
Factor
like
VIII.
all the factors are used up. But this disseminating coagulation, whatever, it is just used up for no reason, and the person just starts bleeding from anywhere. That's how it explains.
Anywhere.
But
Ma'am, the
disseminating
keyword here.
intravascular coagulation is a disease or disorder? Is it a disease?
Now I have to check that now.
That is asking me the question whether it's a disease or that's an event or the situation.
It is a disorder, ma'am.
But
the keyword here, ma'am, is all the clotting factors. All clotting factors.
All of a sudden, for no reason, it will just be used. So the person will just start hemorrhaging for no reason.
Right. But no, they are usually They usually occur for patients who are in ICU. Like they are all bluish all over.
Yes, a
Yeah.
picture of somebody in the
Yeah,
abdomen
they're all
area
bluish all
was in
over.
the D12.
Yeah, cyanosis happens. So there is no blood, right? So there is no blood. That means the blood,
There's
all
no
blood is.
clotting.
Yeah.
Yes, ma'am. Uncontrolled hemorrhage.
Okay. Wait and see.
Just let me see. Is a disorder or not?
Yes, ma'am. It's in D2L.
Is said the disorder?
Yes, ma'am. D2L says this is the disseminated intravascular coagulation.
Yeah, it's an inherited bleeding disorder in which the blood does
Inherited blood
Disorder.
inherited blood disorder. Okay, then
Yes,
it's good.
ma'am.
No,
Okay.
the hemophilia is a disorder too.
Yeah.
It's
Okay.
inherited.
That's I know.
Mm-hmm.
Okay, let me see. DIC is a rare blood clotting disorder that can cause organ damage and uncontrollable bleeding. So it's also telling is a disorder.
Yes, ma'am.
It's not a disease, but disorder.
Yes, ma'am.
So let us choose that one. Major to me, you can just choose the
Ma'am,
B.
if you look at the last page before, I mean the last slide before the end of that coagulation slide, it clearly explains it like a pictogram. It says disseminating intravascular coagulation, underlying disorder, first step.
Can you
coagulation
okay. I'm not even there. Just okay. So I have
the
to go
last
to that.
one
No.
question.
I have to go to the content. Then I cannot understand.
Go to the content, the last one before the questions.
What unit is that one?
Unit 6 to 7.
Okay, so just give me.
Yeah, coagulation disorder.
Okay, just
6
give
to
me
7, the
6
last
to
slide.
7.
You will see the picture I was talking about where the man was bleeding or somebody, a patient.
Okay. What is the slide number?
44.
Okay, so let me
43, 44, yeah.
Underlying disorder, DIC. Oh, underlying disorder. Oh, this is telling the disorder for sure. Yeah. So it says subcoagulating cascade case blood loss, all clotting factors are used of severe hemorrhagic bleeding. Yes.
That's it.
Yeah. This happened to my mom when I was there in the feet.
Oh, sorry about that.
Yeah.
Sorry to hear that,
under
ma'am.
the under the feet, totally under the feet become totally clotted. Yeah.
Yeah, this is fatal, ma'am, actually.
I know. I was very worried, but I became get out of there. Okay,
yes,
so did a breakdown of fibrinogen if these are produced fibrinogen can be tested for D-dimer clotting factor. This okay. Unregulated generation of thrombin that leads to further platelet activation, leads to fibrin formation, then the consumption of fibrinogen factors as well as depletion of. So it can do these of the hemophilias factor different things, but the dear said okay, so that is best should more suit about the B. Disease, so it's not a disease. That makes me confused. I did like that. Sometimes you doesn't pay attention. I didn't pay attention to the disorder. So what clotting disease? I came to my disease. So right. So it is not an inherited disease. It's a situation. So as it said the clotting disease, I paid more attention to the disease. But you guys did good analysis. I really proud of you guys. Good studying. Thank you, Amina. Thank you. Because I focus myself. That is the thing sometimes we miss, right? That's why you need the attention detail. I was going through so many questions and answers to did that. I just looked at the disease only. So it's not only disease, they also give the / disorder to make me confused, and I got confused.
Thank you.
Okay, thank you. Okay, next one. Which of the following is true regarding the Prothom time test?
A. Letter A.
The result is used to calculate for the INR. Tired.
I know. See here, it looks me two answers are correct. That's why I wrote it. It is also known as the PTT. PTT, prothrombin time test.
So
Yeah,
it's a
you are
swap
right.
then?
So either of the two will be
Yes.
correct, ma'am.
Yes, to me both are looks like right. So very close answer.
Yeah,
Miss?
you're right,
Yes.
ma'am. You're right.
Miss?
Yes.
Sometimes what I find is that I'm in the test or exam and I see two answers that make sense, but you can only click on one. In this situation, what is the best one?
This one, in this case, in this question, okay, click A. If they say B, we are going to learn and we are going to get the marks. Okay.
Okay. Thank you,
So I'm
miss.
just, yeah,
That's what
I am
we
putting
have.
here all my red color so that I know if there is any problem. So you can just correct it. Okay. So more
Thank you.
suitable is A, but it also seems like prothrombin type test. So PTT.
Okay.
But at the same time, you can see what is the true. PTT is the name of the test. PTT is the name of the test. But what factor is true is a used to calculation for the INR.
Yeah.
So if we analyze in both ways, it looks both questions answers are quite. So A is more suitable, but B also the name of the test.
Okay.
Yeah. So next one you guys know.
Yeah,
It means CBC analyzer, that you know, right? Cyan metabolic. What is the answer?
I met with a Korean.
Cyan, met, cyan, break it. Cyan, that's the cyan. So cyan, met, hemoglobin. Break it. Then it's going to be easy.
Cyan met hemoglobin.
Cyan means cyan color. You know that there is a cyan color, right? The light blue. Cyan, met, and hemoglobin. Cyan, met, hemoglobin.
Cyan met hemoglobin. Thank you, miss.
Okay,
Cyan
no
met
problem.
hemoglobin.
Yeah. Next
You're in
one.
love.
Yeah.
Cyan met
This
hemoglobin.
one you know, cancel the test. Okay. Next one, not required for blood clotting.
Histamine.
Histamine is our answer, ma'am.
Yeah. What is which of the following substance is not required for blood clotting? Yes, histamine. Blood clotting. Blood clotting. Clotting. Blood clotting.
Because when I look at the platelets, the platelets is the sodium is and the fibrinogen is.
Yeah.
I look at this one. So the only one that I didn't find is the histamine. Histamine.
Good girl.
Platelets. This in the blood clotting. Clotting. Obviously platelet. Yes. Okay, next one. How is the extrinsic pathway activated?
We're talking about the external part.
Yeah, external tissue domain. External tissue domain. Extrinsic means external. When there is a damage, when it's a cut or anything, that is a part of the first pass is the extrinsic pathway and parallel the intrinsic pathway activated for the hemostasis or blood clotting. Okay, stopping blood and coagulation. Okay. Next one.
Which of the following statement is correct regarding the CBC specimen? It's C.
Yeah, good. Next one. Circulating reticulocytes.
I said B.
B. But sometimes you can see some results from outside that is 0.5 to 2.5. Okay, depend. But the circulating reticulocytes is very, very low. When the reticulocytes level become higher, when the peripheral circulation, when will be the higher rate of reticulocytes?
Bleeding.
Bleeding. or you need the oxygen deficiency when there is a need of RBC.
Yeah.
Basically, anemia, any kind of severe anemia, blood loss, when they are going to the high altitude, everything. So when there is a need of RBC or oxygen or hemoglobin, there will be chance of more reticulocytes in the peripheral blood. Okay, next one.
Letter C.
Okay.
MCV.
Okay, next one.
You have the answer already, ma'am.
Hemophilia.
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 Yeah. What is the purpose of the INR? What you do the INR test?
To monitor both warfarin and
Tells how-
heparin therapy.
No, that is the purpose of INR. Why you do the INR test?
Tells how long it takes for your blood to clot.
Blood clot. Yeah, it's called the prothrombin time or PT. Okay. Okay.
Yeah.
I'm going to feel asleep. I am already tired.
Evelyn, go for it.
No, I'm just okay. Next one. Go ahead quickly.
Yes, ma'am.
Letter B.
Okay, I will go.
Okay.
Well, which of the following is true regarding an automated CBC analyzer? Our answer is letter B.
Oh, I told you yesterday. Yeah.
Yes, ma'am.
Next one.
So this one is which
That
of the
is also
following?
This is also answered yesterday. Lithium heparin. Yeah. Next
Lithium
one.
heparin. That's
Yeah.
right, ma'am.
Next one. WBC
WBC differentiation. Yeah, it's letter C.
Okay. Next one.
Next one. What term describes the destruction of RBCs? Hemolysis. What is the primary hemostasis also known as? Letter A, platelet plug formation. And you answered the next one, ma'am.
Yeah.
The freeze between 4 and 8 degrees.
And I also heard that one WWF yesterday.
Yes, ma'am. Letter D.
BWF.
Yeah. Letter D, yes.
Mm-hmm.
Component of the coagulation.
What's WWF?
WWF, you know, World Wrestling Federation.
You're doing boxing.
I used to watch. I went so many times in the real arena. You know, when I was in USA, I used to go to the arena to see the Hulk Hogan, Macho Man. I saw their direct fighting there. Yeah, boxing. Yeah, it was fun. WWF. That's why I made a fan. Yeah, BWF.
WWF this morning.
The boxing, mom, eh?
Boxing, yeah.
Okay, next one, component of the coagulation system triggers primary hemostasis. Our answer is platelets.
Good. Next one.
Why is it important for CBC blood tubes to be thoroughly mixed? Our answer is A, ensure even distribution.
Okay, did you all apply that one when you were doing this in the lab?
Yes, ma'am. It's important.
Not everybody doesn't apply. That's why your smears are different. Your hematocrit is going to be different. So you can understand every time you have to, for the ESR, hematocrit, slide, anything you do, you have to convert from the CBC tube to proper mixing. What is mixing? Means even distribution of all blood components. Okay.
Yes, I think that's what happened to me once. I picked up the tube, but I didn't mix it. It gave me an AB minus.
See,
in my blood reading.
So
even though I'm AB, it gave me AB minus.
Because you are taking from the top, right? You're not going inside, deep inside. The hematocrit tube doesn't went too deep inside where the all. Even you do that, is going to give you false result because the cells are packed there.
Yeah.
Already. Okay. So always never forget to mix this one. Okay. This one, the INR. You are not going to taste the INRs, but mostly these things you may taste. So yeah, be careful. Next one, MCHC. What is that?
Letter B. Yeah. Mean corpuscular hemoglobin concentration. The calculation is letter B. Hemoglobin over hematocrit.
Yeah.
Next one, desired quality for the diluent used in an automated CBC cell analyzer is letter B, good conductor of electricity.
Okay.
Next one, ma'am, definition of hemostasis, letter A, the mechanism that stops the bleeding.
Okay, so the hemostasis,
Uh,
yes, okay.
Yes, ma'am. Major coagulation disorder is vitamin K deficiency.
Exactly, yeah.
Yes,
Yeah.
ma'am. Letter
Okay,
C.
good. Go ahead.
Yeah, what is a coincidence error with regard to the Coulter principle of cell counting? Verna
You
has this
doesn't have to read because everybody has in front. Just give me the
answer.
answer
Yes.
one by because it's going to
Letter
take
B.
time. Yeah. Letter B.
Yeah.
Next one.
Letter B.
Letter B. Ma'am, I have a
But
question
you-
regarding
yeah.
this.
Yeah.
I have a
Yes.
question, ma'am. Because when nucleated RBC will go through also, there will be a correction of the WBC because they will be read as RBCs. Nucleated RBCs.
No, you
Counted
cannot.
as-
No. It's going to go the do different chambers. You saw that one? It was RBC
ma'am.
and yeah. So they are different chambers. So RBC cannot be counted as a WBC.
Okay. No,
You
the
see the
nucleated.
Kotler chamber? Kotler, yeah. There are two chambers, right? One is going to the
Yes.
RBC and platelet, I guess, and another is WBC. There are two different. So the RBC cannot be counted as a WBC. Oh,
Okay.
when a nucleated RBC, that's a separate chamber. Oh, you understand what you mean. Nucleated RBC is counted at WBC. No, this is the two
Exactly.
different chambers. Two different
Yes, ma'am.
chambers.
We
If you
usually
just
do
look
that.
at, if you just look at, if I remember, in the Kotler chamber, the WBC
Mhm.
counter tank is different than the RBC.
Yeah. RBC and
That's why,
platelets in another chamber.
yeah. So that's why
Oh,
there is a chance that nucleated RBC can be counted as that one.
okay then, ma'am. Thank you.
That's my analysis. Yeah.
Yeah. Because we
Yeah.
used to do that, ma'am. We correct the
Really?
WBC. Yes, we correct the WBC because of those nucleated RBCs.
How you used to do that? I don't know.
There's
But
a formula, ma'am. I forgot also, but there's a formula for that.
oh, okay. That
Mm-mm.
I never
So
use
then,
chamber, to be honest with you. If you did that, you may know much better than me. I have no idea about that. It
no
didn't say
worries, ma'am.
me. Yeah. It didn't
It's
say
our
any on model also. So
yeah.
it didn't.
Okay, ma'am. Thank you.
No. Thank you. Maybe you can teach me one day with the formula. Yeah, but
Yeah, I'll
no.
try. I'll look for it.
Yeah. They're always good to know. But
Yeah.
they didn't tell us anything about this one, right? In the in our
Yeah.
model PowerPoint. Yeah. Okay. Next
Yes,
one.
ma'am. Okay, next one is letter A.
Okay.
Not part of CBC.
Okay.
Next one is side light, letter A.
Yeah, that
Large.
yesterday I
Yes, we
discussed.
did that. Yeah.
Yeah.
Next one is RDW, letter B. Anisocytosis present.
We did.
Red cell distribution with the measurement.
Measurement. Okay. Size.
Yes,
Yeah.
letter
Size
B.
and isocytosis. Yeah.
Yeah. Next one, unit of measure used for platelets is letter A, times 10 to the 9 per liter of blood. And the last one is not a plasma protein, is the fibrin.
So fibrinogen is a plasma protein, but fibrin is not.
Yes,
Okay?
ma'am, not.
Because fibrin is formed from the fibrinogen. So it's a fiber, it's not a protein anymore in the plasma.
Yes,
Okay.
ma'am.
Okay,
And we
number
didn't go
one.
through the blood types anymore because the answers you have already given it to us. Thank you.
Yeah. Okay. But you have to understand, it's not like
Yes,
that
ma'am.
your Moodle is going to give all the answers to you. You have to understand the meaning, what I tell you. Okay. So B,
Yeah.
then there
Wait, so
is
the answer to that,
yeah. So
sorry,
all
the
are red means that is negative, which is clumping is positive. And when there are all clumpings invalid, you did that in the blood typing activity when I did with you guy in the class that day,
Yes,
right?
miss.
Okay.
Yes,
In
ma'am.
case,
sorry, miss, I have a question. The
yes,
last
yes.
question is letter D, fibrogen.
Yes.
Fibrin.
Fibrin.
Sorry.
Fibrinogen. Fibrinogen is
Fibrinogen.
plasma protein, but fibrin is formed from the fibrinogen through the chemical or enzymatic reaction. And this fibrin is the fiber which helps in the making the mesh or network so that the blood can stop and the all platelets can stay and aggregate and caught there to make a on the mesh.
Mhm.
Okay.
Christiana has a question, ma'am. Raising
Christiana
her
is
hand.
here when she came.
Yes,
She's
Miss, I'm
raising.
here. I came in around 10. I'm having a really bad day today.
So you didn't text me or anything, so I made you absent already.
Miss, oh, that's fine. That's okay. I'm here to listen. That's okay. Just a lot is going on. I was dropping my kids off to school and I noticed my car wasn't in my parking spot.
Ah,
Yeah,
who steal your cars?
I don't know. So that's why the whole morning I was on the phone with the police and my car insurance. So that's why
Oh my
people are just
God.
wicked.
So did you get what is called? Did you find someone?
Yeah, I have a tracker in my car from Acura, and
Yeah.
my husband also has a personal tracker in there. So I guess it's just a common car that they steal, I guess. So it's been a rough morning. So sorry I'm late, but I'm just letting you
Okay.
know.
No, that's good, but what I'm going to do, I'm already make you absent. In case any day
It's
you are
okay.
absent for any day, that
Yeah.
day I will compensate you making present, okay?
Yeah, it's okay, miss. Thank you.
Yeah,
Don't
okay,
worry.
so no,
It's okay.
sorry. I'm sorry because it's even around 9:45 I just did that one.
Yeah, usually I'm here before that, but
Yeah, that's why I
yeah.
thought maybe you cannot come. I just called that time. Okay,
Yeah,
sorry
it's
for
okay.
that.
Okay.
Okay,
Sorry,
okay,
sorry.
okay.
Crazy.
So
Sorry,
yeah.
class. I interrupted you
Yeah,
guys. Sorry.
no.
It's
If you can just,
okay. It's okay. We just hope
it's
that
okay.
everything
Yeah, that
works
not so
out.
bad. Yeah. If you can if you can just text me like Sabana did or the Rugiato didn't tell me, but I just waited. But she came by 9:40, so that's why I waited up to 9:50 and then I closed that one. It's okay. I'm
Yeah.
sorry.
Okay. It's okay, miss. Thank
It's
you.
okay. But I can compensate in case you are absent for another day. That day I will make you present so that you are not losing the day. Okay.
Oh, yeah. Okay, miss. Thank you.
That's so
Don't worry.
nice.
That's
Thank you
so
very much,
nice,
miss.
ma'am.
Okay,
Yeah.
thank you. No problem.
Thank
You see
you.
that we
Appreciate
love you.
it, ma'am.
Huh?
You see why we love you.
Yeah,
That's
exactly.
Love
That's
you,
why we love you.
yes.
Oh, okay. If
Yeah.
something happens to if it may happen, I always think that I need you guys to. I can hammer you. I can scroll on you for your study, but everyone's life can happen anything. But if I know in early,
Yes.
then it's easy for me to the take care things like
Yeah,
they
sorry about
texted
that.
me.
My
No,
mind
it's
was
okay.
just like
I
calling the
understand, but
police.
what
I
I
was
can
like,
do, what I can do in case you are absent, it may happen. It's a long course till now. If you absent one day, I will compensate that one. Okay, so that you are not going to lose one day being present. Okay,
thank you,
no
miss.
problem.
Okay,
Okay,
okay.
okay,
Sorry, class. Okay, bye.
okay. No, it's okay. Okay. Where you are? Pancytopenia, you guys know. What are the indication of the anemic state? Probably I gave you the answers.
Low
Yes,
red blood.
ma'am.
Yes, I give you the answers. That's why I told you I'm stupid. Yeah. Anyway, pancytopenia, the marked reduction of everything.
Yes, ma'am.
Everything in the peripheral blood. It's the RBC, WBC, platelet, everything. Okay?
Yeah.
Okay. So that, and increased number of leukocytes is called?
Leukocytosis.
Decreased number of WBC?
Leukopenia.
Leukopenia. Increased number of erythrocytes?
Erythrocytosis.
Decrease?
Erythropenia.
Platelet?
Thrombocytopenia for low.
And low?
Thrombocytopenia.
Good. So you can understand cytosis means generation, penia means decrease. Whatever is RBC, WBC, platelet, whatever may be. Okay?
Okay.
Okay. What is defined anemia? Probably I gave this answer too.
Yes,
right?
ma'am.
Okay.
Yes,
So I
ma'am,
know.
yeah.
Okay. What is the Canada hemoglobin concentrated presenting in which unit?
Grams per deciliter.
Grams per DL.
Gram per DL. Gram per liter. Sorry, gram per liter, I guess. Hemoglobin. Gram per liter, right? Gram per deciliter.
Deciliter,
Yeah,
ma'am.
34 grams
Gram per deciliter, ma'am.
Okay. DL.
DL.
Gram per DL. Yeah.
Why kind of the bro? Yeah, I can
Cute.
fix it later.
What is the purpose of INR? Is Sabana's son?
Verna's son, ma'am.
Verna's son. Okay.
Yes.
What is the purpose of INR? What is the purpose of INR?
Letter D, ma'am.
Okay.
Warfarin and
Okay.
heparin.
Okay. INR. Yeah. Monitor both warfarin and heparin therapy. Next one. Function
Functional
of.
fibrinogen, letter A.
Yeah,
We
for
already did this
fibrin.
one. Yeah.
Yes,
It
ma'am.
comes in the different format, but is the answer
Yeah.
is we have the same answer before, just in writing. Okay, good.
Yeah.
How the this was also we did.
We
This
also
is
have
a
that. Yes.
yeah. So this is
Yes,
also the
ma'am.
so how the different questions come. I collected from different area and I just give it to you. Yes, I ignored it when there is a duplicate one. Okay.
Yes, ma'am. Okay.
Okay, no problem. Let me undo it because otherwise it's going to get certificate. Okay, so what is the primary hemostasis also known as?
You give this vasoconstriction.
Yeah.
Okay. Good. The process. Okay.
And
Next one,
this is
what
a
coagulation test is used to look for
We have the
deficiencies?
same question again.
Yeah, that was the same question. Disseminating. So ignore
intravascular
that one.
What
coagulation.
coagulation test? I am asking the next question. What coagulation test is used?
That does not bind calcium. That's the one, ma'am.
What coagulation test is used to look for deficiencies or defects of fibrin?
Coagulation, the dimer.
It's at the
Thrombin time
Is it the
test?
thrombin time
It's
test?
the thrombin time test.
TT.
Yeah.
Thrombin time test.
Yeah.
Quiet.
Oh, where are we?
See, miss?
Where are we?
Yeah, I'm just.
Thrombin time test. Yeah.
I think letter C.
No, where are we?
Oh, page 12.
Page
What
12.
coagulation test is used to look for deficiencies or defects of fibrin? It's thrombin time test.
It's in the last page, guys.
Actually, I read this last night,
A.
ma'am.
Is it A?
The
APTT? Is that the one?
Fibrin degradation product, FDP, is a byproduct of the breakdown of fibrinogen to fibrin. And FDP is related to D-dimer. So this is a
to me,
this
I
is
highlighted APTT. I am also.
APTT, is that okay, go ahead, guys. I'm on a different
I don't know.
page.
I don't know. Even I am confused of this one.
Yeah.
It's thrombin time test.
That is the thrombin time test?
Yes.
Okay.
I
Good.
think you had given us APTT yesterday. I'm not quite sure.
Yeah.
But can you just make mommy, because we
I am also.
$19. Okay, let me see page 19.
Fibrin. This is the fibrin. Fibrin is forming from the fibrinogen. Right?
Yes, ma'am.
Yes, fibrin.
And the FDP, ma'am, the process of test for the FDP is related to D-dimer test.
This that measures FDPs identify the breakdown of products of fibrin. Yeah.
Why do you keep saying that?
So C is confusing. It said in clot-based assays such as PT, APTT, and TT, thrombin time, the time to fibrin formation is detected by mechanical, turbimetric, or other means and compared to standard normograms. So it says both the APTT and TT here because they didn't give the PT. PT-INR, thrombin types, all except the D-dimer, it looks like all of them are. As per the Prothman time. Okay, PT, INR, activated.
Miss,
Okay, give me a time, dear.
Miss,
Give me a time, dear. So the thrombin. It's a thrombin test. Okay. Got it,
yeah,
confirm. Yeah,
because
thrombin type.
it's on
Yeah. Yeah.
it's on the homeostasis on page 19.
Yeah. It's thrombin time test. Okay.
Yeah.
Okay. Next one.
Okay, ma'am. Thank
Okay.
you.
Okay. Sorry. Okay.
So
So
it's a thrombin
last
time
year
test.
also I give you the question, right? Yeah. These are all duplicate questions. I don't know from where it get. Oh, let me delete this. You already did these questions, okay? So this one, degree of anisocyatis is present. Did the one PTT, which of the following is the Prothman time test? Oh, we also did the monitor.
The last one, ma'am.
Yeah. Calculation of the INR. Yeah. Okay. And also we told that it may be a PTT, right? Okay. So this one, okay. Passes through this one also, electrical resistance, we did it, right? Aperture increases. This one we did, right? It
Where
cell
are we?
passes.
Which one, ma'am?
Where are
Which
we?
of the
Last
following is
page.
true regarding the automated CBC analyzer? Is cell passes through the aperture, increases the
Oh, that's D.
Oh, the last
yeah.
question, ma'am. Biggest amplitude.
No, which of the following is true regarding the automated CBC analyzer?
Oh, yes, ma'am. We did that already.
Yeah, we did it, right? Okay.
Yes, ma'am.
See that on my last page. Oh.
We are on
So
the
this
last.
is the repeated one, right? Purpose of doing a differential, we didn't do this one.
I don't see that on my page.
What is
Oh, are
purpose
you
of doing
on
a
finals?
differential?
You're on finals review, ma'am?
No, because this is the not final one. The same thing. I just eliminated couple of tests which are questions which are duplicated. Just go below.
Oh, we don't have that.
Which of the following is true regarding automated CBC analyzer? You have it.
Yes,
Oh,
ma'am. We have
prior,
that.
yes, prior, yes, but not on the last page.
Not on the last page. Yes.
Yeah.
Each cell passes through the aperture, increases in electrical resistance. We didn't do this one. No. What is the purpose of doing a differential WBC count? Did you got it?
No.
Yes.
It's
We have that,
answered.
ma'am.
Okay, B. Okay,
I
next.
think
Next
What
one.
page
yeah, we
is
have
that?
that on the finals review, if I'm not mistaken.
No, that is
It's on
not
the
the final.
final?
That is the. Am I in final?
Most
Yes, we are
probably.
reading and
That's
Oh
what it
dear,
is.
sorry.
Yeah.
we are not
That's
done with
what it
this
is.
one.
My
We need
Because
to
I'm
return to
my
it.
goodness, because I have two things open. Okay.
Yeah.
Okay, so where we are now then?
The last page of the review too.
No, we are
Page
doing
12.
the AFOBs together, platelets and coagulation proteins, vasoconstriction, thrombin time test, and then we are doing the each cell passes through the aperture, increases the electrical resistance, right?
Yes, ma'am.
Okay.
No, that's not on that.
Determine the proportion of the WBC.
No, that's not on that last page. We are supposed to be where you are talking, because the last thing you talked about, which was on the last page, was what coagulation test is used to look for deficiencies or defects in fibrin.
That is the thrombin time test, and then there was a question, couple of repeat question, right?
No,
So
the next question after that,
biggest,
the biggest amplitude of a pulse in a CBC automated analyzer is seen when the machine counts which cell. So
Yeah, that's the only question left in
that's
this
the last
review.
question on that on this review.
Yeah.
So it says the biggest amplitude of a pulse in a CBC automated analyzer is seen when the machine counts which cell, and it gives thrombocytes, basophils, erythrocytes, and monocytes.
Yeah, that's the
Let's
only
answer,
question left.
ma'am.
Have you seen it, ma'am?
No, it's okay. We don't have that. The warfarin therapy, PTINR.
Okay, we
You don't
have that
have-
one too. We didn't answer that. You have not talked about that. It says, what type of therapy does PT-INR help monitor to ensure patients are within therapeutic levels?
And our answer is warfarin.
Warfarin.
Yeah.
Yeah, and before that, VWF, we did that.
It
Yes,
says what
ma'am.
is an adhesive protein secreted by endothelial cells.
Yeah. You did that, right? We did that or no?
Not yet, because you skipped.
Okay, so where we are now? We
Just
did
the
up
last
to this
question.
one, and it,
Biggest attitude.
Okay, so warfarin. Next one, what coagulation test is used to look for deficiencies of fibrin? We
We
told
got
this. That's the Thumrin time test, right?
Yes,
Okay.
ma'am.
Okay.
And the last one.
Okay,
The
just give me a
biggest
second. Give me a second. Give me a second. It's getting old.
And I don't
the
think
biggest amplitude of a pulse. Yeah, that is the monocyte because that is the biggest cell.
Yeah.
So that's why it happens.
Okay. Amina is correct, ma'am.
Yeah, I told you.
Yes. She's correct, ma'am.
Sorry. So, the question answer is C. Sorry, guys.
The biggest amplitude of a pulse in a CBC automated analyzer is seen when the machine counts which cell. Monocyte. This is the huge big cell. So that's why it gives you the biggest amplitude. Okay?
Yes, ma'am. I want to know the question above the last question.
This is the last
last
question.
question.
Monocyte is the last
Sorry.
question.
Oh, sorry. That's the second question. What the coagulation test is used to look for?
That is we discussed. Thumrin time test.
C.
C.
C. Okay. Oh, got it. Thank you.
Okay. All are done now?
Yes, ma'am, we're
There's
done.
one question I'm seeing. I don't think we talked about that now. It says, what is the red cell distribution width measurement of?
Anisocytosis.
That we did. We did before. That we did before. That's why I skipped it. It's a duplicate question. So that's why I just skipped.
Yeah, so
we are already we already discussed this, so I just skipped that one. Okay, so close this one. Okay, so you want to go for break and then we can go to the final and go done?
Yes,
Or you want to do
Yeah,
the
yes,
final?
ma'am, please. Thank you.
Okay.
Break, ma'am. Thank you.
Okay.
Yeah, Miss, I'm gonna be leaving, but I'm gonna put my phone on my phone after the break.
Okay.
So 11 o'clock.
Everybody is doing these things, have to pay me at the end.
This one I gotta go. Thank you so much, Miss. But I'll be on.
What is my fee, you know?
What was that?
What is my fee? What is my fee?
Right?
I'm gonna let you fix that. I'm gonna let you rate that one.
You're
100 per
priceless,
hour.
ma'am. You're priceless.
90% marks from the exam.
Yes, that's what you
and
prefer.
in ML Power and CSMLS high numbers.
We're gonna try our best.
Yes.
Okay.
Yeah.
And I'm gonna give you a big thumb up. There you go.
Okay, no problem. No, I just need a really good marks from you guys. That's I want. So that everybody can Moon students are the best.
Yes, Miss. I know you need a success. I feel it and I know that, Miss. So we're trying our
You
best.
will, because I know you have the potentiality.
Yeah.
If you don't
thank
have
you.
it, I'm not going to tell you. Okay?
Yeah, thank you.
Okay, go for
All
break.
right, so 11 o'clock.
Oh, 11:05.
Yes, ma'am.
Okay.
11
Okay,
o'clock.
thank you. I'll see you.
Okay.
Okay, bye-bye now.
Miss, are you still there? Miss Moon?
Joanna, she said she'll be back at 11:05.
Yeah, I was about to tell her that I have to leave too.
Oh,
Yeah, it's okay.
you can put it on WhatsApp, I guess.
Yeah, I'll just tell her on WhatsApp. Thanks.
Okay.
Joanna, do you have any question? I can't hear you.
Yes, Mom. Oh, sorry.
Yeah.
Yes, I do. It's not a question. I wanted to let you know that I have to run to the pharmacy real quick. I have to get my husband's medication because he kind of needed at work. So I don't know why he didn't took it yesterday at the pharmacy. It's just half an hour and then I'll run to his work and I'll come back by 11:15.
Okay, go. Run.
No, Mom, I was just about to do it. Thank you.
Don't do accident. Go run.
I won't. Thank you. Thank you so much.
Okay.
Hello, Mom.
Uh, uh, Ready? Alexia, Huda, Maddie, come on. Then you can start that one. Who is left? Kara is not here, and I think Asnet is not connected till yet. Okay. Joanna is on the cart till now. You got it? You got the medicine?
I'm in the pharmacy right now. I'm going to the
Okay.
pharmacy right now.
Okay.
Hello, ma'am.
Yes.
I have sent you the link for that the one mentioned nucleated RBCs. It's in
Okay.
your email. It's a
Okay.
long
So
read though. Yeah,
okay.
got it.
I'll check then or later. Thank you.
You're welcome, ma'am. Thank you.
So should we start now, please? Because I have a meeting another one.
Yes, ma'am.
Okay. So let us go to the final one. And
Okay.
in the final one, whatever you have the confusing questions, we can go through that one, or you want to go one by one, whatever.
We can start with questions that we have confused.
Okay, so let's do that. Tell me the which page and which number, whether it's a
Yes.
patient. Yeah, because there are a lot of repetition questions. That's what I'm
Yes.
telling. Yeah.
Yes, ma'am. Or you know what, ma'am? It would be much better for us if we will read one by one. We don't have the 100% confidence that our answers are correct.
Okay, then go ahead like that. Don't read the full questions, but still the answer.
Yes,
So
ma'am.
starting now. Yeah.
Just the answer.
Yeah.
Yeah. Can start? Okay.
Yeah. Yeah. Please.
Accurate description of a hematocrit. Our answer is we're on page 1. Measures the PAC RBCs in whole blood.
Okay. Good. Next one.
Collected blood tubes
Number
transfusion department. We cancel the test because collection information is missing. So cancel the test and request a recollection.
Good.
Next one is
leukemia.
Leukemia.
Okay.
Uncontrollably multiplying inside the bone marrow.
Yep.
And you have answered this, hemolyze.
Yeah.
And the next one is factors can affect the
I told the
sedimentation.
transfusion reaction hemolyze, and also there is an option for agglutinate. I don't know which option they will give. So
Yes, ma'am.
to me, both answers are right, but you can
Yeah.
put anyone else, and then you can find in the D12. Okay, next one.
Okay, ma'am. Thank you. Yeah. Okay, factors can affect the sedimentation rate. We answered decrease in plasma proteins. This we're not sure.
Yeah, plus everything is what is the sedimentation, diameter, room temperature, everything, I guess. Diameter of the tube, decrease in the plasma protein, height of the tube, except the height of the tube. I think all are right.
Can
We'll
affect
see.
the
Yeah,
sedimentation rate.
if the room temperature is too low, it's going to take time. If the
Yeah, that's
diameter,
true.
if the diameter of the tube is too wide, it's going to settle down very quickly. So to me, all are looks right.
It can it affects all of it except you said the height of the tube.
Also, the height of the tube also matters, right? Because if it is a
Mm.
long tube, it's generally 100 or 200.
Yeah,
It's
that's right. The wind tube is 100 millimeter.
Yeah, and Western Guinea is 200. So there is two.
200,
That's why Western Guinea tells is the height of the tube, because it said that's due to the length of the tube. Western Guinea is more more accurate results. So
That's
to me,
right.
to me it looks like all are right.
Okay.
We'll see.
Thank you.
What type of option they give. To me, all parameters are right.
Yeah.
Okay. Next one.
Type A positive. The antibodies are B, and in the plasma. Next is most active with viral infection is lymphocytes.
Sorry for the question that which of the following factors can affect the sedimentation rate. So which one do we agree on? All of them. So which one we're going to choose if the question asks us to choose
following factors? Yeah, all of them.
You can choose any one of them. If there are all of them, you can choose all of them. We'll see what the D12 said. But all the factors, all the parameters can affect the sedimentation rate.
Okay.
We'll see what is the answer what are the options they will give, okay? Choose any one of them. If they have two options are good, you can choose only one. They are going to give you one. If there is any discrepancy, we'll look for there from the D12, okay?
Okay, ma'am.
Okay, next one.
Thank you. Okay, next is the ESR measures the settling, uses units of measurement, RBCs and millimeter per hour. Where is the RH factor antigen located? We'll say RBCs of people who are RH positive.
Exactly.
Yes, ma'am. What is not a characteristic of the right stain? Number 2, supravital stain.
Exactly.
Yeah.
Next
statement.
is
Yeah. Somebody say.
Anyone trying to say something? Any suggestions? Evelyn, go.
Okay, ma'am. Statement is correct regarding granular leukocytes. They have visible granules in the cytoplasm.
Good.
And you have already given the answer for the next question.
Yeah, blank. Yeah, short draw blank, presence of a clot. Yeah.
Yes,
there are two conditions. Yeah, there are two conditions. Yeah, where we can reject the sample. Okay.
Molecules of hemoglobin 4. You have given that too.
I know
and
it's
you
going
have
to be
answered
difficult
this
for
yesterday. Unconjugated bilirubin.
Conjugated one. Yeah.
Yes, ma'am.
The next one.
Next one, characteristic of a quality peripheral blood smear.
Yeah.
We have confusion here.
Yeah. What is your answer?
My answer is number 1, monolayer.
Yeah, that's monolayer at the end of the slide.
Okay,
because it go from thick to thin, right? So nice monolayer at the end of the slide.
Yeah. Yeah, it's in D2L, ma'am. I read it last night, actually.
Yeah, okay.
Okay, blood antigen surface in an individual has type B pus blood. It's B and RH.
Good. Very good. Very good. Very good. And what antibodies is going to be present on the
anti-A.
Anti
for the D. Yes,
okay.
ma'am.
And where it will stay?
Sorry, ma'am. Yes, ma'am. RH is there.
No. RH is going to be antibody is going to be located in where?
In plasma.
Plasma or serum.
Exactly. And where the antigen is going to stay?
On the surface of red blood cell.
Good. Very good. Very good. Okay.
Next is the ESR. Must be taken to ensure Western green tubes are vertical.
Exactly.
Yeah.
All others cannot be. Yeah. Next one.
That's true. Romanowski stains, combination of AUCIN and methylene blue.
Okay, good.
Statement is true regarding ABO, the last one. A person has antibodies in their plasma for the antigen not present on their RBCs.
ABO blood type is antibodies in the plasma for the antigen. No, it's the opposite antigen. Yes.
Yeah.
Good.
So
Okay.
number 4, Mame.
Yep.
And you have given the answer to this? The
Hmm.
WBC and platelets?
Everybody knows that. Yeah. Now you guys
Yeah.
all know. Yeah.
Yes, ma'am. Intact blood vessels maintain hemostasis. You have answered this. Inhibits platelet aggregation.
Okay.
They're
Good.
continuously flowing.
Yeah.
Yeah.
We discussed about yesterday. Yeah.
That's right, ma'am.
Yeah.
Factor may cause a blood smear to appear too thin. We have that in the last exam. Spread too quickly.
Mm-hmm.
Primary phagocyte, humoral immune response. I think you answered this also yesterday. Neutrophils.
Lymphocyte.
This is the
Phagocyte.
confusion. Lymphocytes, ma'am.
Humoral response. Immune response. Immune response is lymphocytes. There is a immunity is always by the lymphocytes. Okay.
Okay, ma'am. Thank you.
Yeah.
Well, yeah. Not neutrophils.
No, neutrophils goes directly. It's not the immunes. Immune is responsible, but lymphocytes, beta and T lymphocytes, mainly the T lymphocytes.
Yeah. Okay,
Okay.
ma'am. Thank you.
Okay.
Next one, test which determines the number of immature is the reticulocyte count.
Exactly.
Yeah, immature RBCs in peripheral circulation.
Yeah.
Next one is the possible that mothers form antibodies to her babies incompatible RBCs. Our answer is the IgG, the gamma immunoglobulins antibodies can cross the placenta.
Exactly. We discussed this yesterday also, right?
Yes, ma'am.
So there is a problem with the hemolytic disease of newborn. Okay.
Right.
Next one.
Next one, type of treatment for patients who have polycythemia vera is a phlebotomy treatment.
What that means? Phlebotomy treatment means?
Polycythemia is high RBCs or hemoglobin.
So you have to take out the blood. That is the phlebotomy. Only by the phlebotomy you can take out the blood.
Yeah. Yes. Yeah. You mentioned that also before.
Yeah.
And this one we have the collection of from Canadian Blood Services is the 42 days from collection.
Exactly.
The expiry.
Yeah. We just
Yes,
regular
ma'am.
one. Yeah.
Yes, ma'am. And platelets are nucleated, false.
Okay.
What blood cell information is demonstrated on the vertical? You have also your note here, and it's the number of cells. You have also have the answer for producing erythropoietin, kidney. Artery delivers blood from the heart to the body is the aorta. Test procedure uses a Winthrop tube is the ESR, erythrocyte sedimentation rate, which a granular white blood cell can move from blood into tissue and also considered phagocytes or the monocytes. In case of emergency, what blood type can be transfused without any pre-transfusion type and screen testing is O negative.
Exactly. Good.
Yes, ma'am. Diluent used in the CBC analyzer needs to be isotonic. The answer is a solution that has the same ionic concentration as the plasma. Yeah. Why take blood smear used for parasites?
Everybody understand that? Whatever we are giving the answer? We are giving the answer, discussing it. Everybody understand the reasoning, right?
Yes, ma'am.
Okay. Go ahead.
Okay, thick blood smear. There's also your answer here.
Yeah, because I already gave it, it's a written answer. Okay.
Yeah, you have also the answer for the 15% Canadian population who are Rh negative. Component of whole blood is removed for whole blood donation. For the use of manufacturing of specialized protein products or plasma.
Yes.
Yeah. Next is a blood tube collected for a CBC test. And what does the anticoagulant do? EDTA and binds calcium.
happened to my? They can see it here. Why cannot see it? My God. I'll fix it over. So PTA binds to calcium, okay?
Yes, ma'am.
Next one.
Next. MLT is performing a differential. They do not count any basophils. What disease process? Our answer is none. This is a normal finding.
Yes.
They do not count any basophil.
Yep. It's rare. Basophil is rare. Until
That's true.
unless, yeah.
Yeah. What is the most common pre-analytical error? Is still patient misidentification during collection.
The most common yeah.
Transfusion reactions. Yeah. The next one is a pregnant woman, Rh negative. What preventive measure is done to avoid hemolytic disease of the newborn? We administer an antenatal immune globulin, the ROGAM.
So, okay, just where we are. The pregnant woman is Rh antigen negative. What preventive measure is done to avoid hemolytic? Perform anti-skin each week. The antibody, the first jaundice, blood type, administer antenatal immunoglobulin D, blood type further.
Yes, ma'am. This is also correct, right?
Yeah, both are correct. Yeah, so let us put both of them together, okay? We'll
Both.
see. Yeah.
Yes, ma'am.
Because we can do the generally it says you have to put the immunoglobulin D things, but if the father is Rh negative, then there is no problem. Yeah.
That's
okay.
true.
Both of
Yes.
them. Yeah. Okay.
Yeah.
Let us put this two and we'll get it from the D12 if the questions comes. Okay.
Right. This is I was wrong here yesterday. Universal plasma donor. It's AB negative.
Exactly.
Or
Because
AB.
it doesn't have
Yeah.
It doesn't have any antigen, right?
That's right.
Yeah.
Yeah.
Okay.
And main function of blood, we say transport of oxygen, transport of
Transportation. Yeah.
nutrients. Yes,
Basic
ma'am. You
one
may
word transportation.
you
Yeah.
have already. Yeah.
Yeah. Transportation for everything. Yeah.
Yes, ma'am.
Hormone, everything. Yeah. Okay.
Right. Coagulation and immunity. So the next, yes, ma'am. What is the most suitable stain used for identifying immature RBCs by staining? We have a confusion here, and my answer is new methylene blue.
Exactly. The immature RBC means reticulocyte, and we stain
Yes, ma'am.
reticulocyte with the new methylene blue, and that is the only stain you need the incubation before making smear. All other stains you have to make smear, then you have to dry it, then you have to stain it. Only for the reticulocyte you have to incubate the blood with the new methylene blue stain before 10 to 15 minutes before, and after that incubation we'll make the smear in the slide, then you are going to see. This questions comes which dye needs to be incubation prior to staining. Prior to smearing.
So it's only
Okay.
Yeah.
And new methylene blue is also supravital stain. Okay, next one. Go ahead.
Yes, ma'am.
What
change make up normal adult hemoglobin is 2 alpha and 2 beta.
Exactly. Okay.
Yeah, because you have already the answer, the 4 pairs, I4 globin chains. Which blood vessel has the highest blood pressure? Arteries.
Okay, you guys made a lot of these questions came in the test one. Lot of people made a lot of mistakes. Somebody turns vein, somebody does capillaries, some will arterioles. Make sure which vessel. Artery has because the main oxygenated blood is pumping out and is going through the aorta. So main pressure is on the arteries. Then arteries to the branches of the arteries, then the pressure goes to the arterioles, then there is a exchange in the capillaries, then is going to the venules, and the vein has the lowest pressure. You guys made mistake. That I didn't expect from the last exam. Okay. Okay.
Okay. Now we are going for the staining. We have different views here, ma'am. The RBCs are pink, pinkish,
pinkish orange.
Pinkish orange. Next one is the nuclei of a leukocyte.
Purplish blue.
Blue.
Purplish blue.
Purplish
Violet
blue.
is, yeah.
Blue to purple.
Neutrophilic granules appears pinkish violet.
Neutrophilic, pinkish violet, yeah.
Eosinophilic granules appear red.
Reddish orange, something like that. Reddish, yeah. Basophilic, blue.
Dark blue, yeah.
Or bluish. Yes, so next one is the primary factor which initiates communication to the endocrine system to release erythropoietin into the bloodstream. We have also confusion here, and I think the answer that majority has is that oxygen levels are not sufficient in
Exactly, exactly. When
Yes,
there
ma'am.
is no oxygen level, they made the questions in a twisted way. Basically, erythropoietin. When erythropoietin release, when there is a need of erythropoiesis, when erythropoiesis is needed, when the red blood cell needs, when the red blood cell is this, when there is oxygen level is low.
Okay, ma'am. Thank you.
Okay.
So primary hemostasis, what blood component is necessary to activate platelet stick is the bone meal brand factor.
Yeah. Okay.
Yeah. Blood component triggers primary hemostasis when exposed to vessel injury, platelets. Not platelets. Primary hemostasis.
Okay. Let's go ahead.
Yeah. Doing a routine WBC differential count, how many cells does the MLT count? 100.
Exactly.
Yes, ma'am. You have the answer for spleen, and you have also for cyanide, for Drabkins.
Yeah, I know this is a little bit tricky on this answer. Okay, next one.
Yes, ma'am. Another term for reticulocyte, we answered polychromatic erythrocyte.
Yeah, to me it's like that, but there are also rubicide. Maybe it's not, but just polychromatic. I thought to me it's polychromatic erythrocytes, but we'll see whether rubicide or not. So that is a very premature stage, but to me it's the polychromatic erythrocytes. It's okay. Next one.
Okay, ma'am. Example of an immature form of a neutrophil is the meta-myelocyte.
Yeah, metamyelocyte. Yeah. But if there is a band cell, then you can take instead of metamyelocyte, if they give the band cell, you can take that one too. Okay? Okay.
Okay, ma'am. Thank you. What happens when a patient who had pre-transfusion testing removes their blood banking ID bracelet? Our answer is the pre-transfusion test needs to be redone.
That we learn, this Monday. Yeah, okay. No one we can compromise for anything. Yes.
So this one I was wrong because I read last night. What is the name of the value achieved when manufacturers of thromboplastin calibrate the reagent again? The World Health Organization International Reference Preparation, and the correct one is International Sensitivity Index.
Okay.
It's not INR.
Oh, okay.
It's in D2L, ma'am. It's in D2L.
Yeah, okay. Good. Okay.
Yeah. Sensitivity Index.
Yeah,
but for PT, ma'am, it's the INR.
Yeah, for PT-INR. Okay. Okay. For the World Health Reference Preparation is the International Sensitivity Index. Okay.
Yes, ma'am.
Okay. Thank you.
Okay. Oh, thank you, ma'am.
Yeah.
So the next one is what tests are performed during a type and screen? Our answer is ABO and RH blood typing and antibody
screen. What is that?
The rarest blood type in Canada is AB negative.
Okay.
Progenitor, precursor of the following cells, either lymphoid or myeloid, plasma cell, unison lymphoid.
Plasma cells is lymphoid, right? Yeah.
Plasma cell, yes, ma'am, lymphoid.
Yeah, erythrocyte,
erythrocyte, myeloid, natural killer cell, lymphoid, T lymphocyte, lymphoid, and megakaryocyte, myeloid.
From where you are telling this one, you know, the lineage, the progenitor, how the total from pluripotent stem cells, all the blood cells generates from the pluripotent stem cells. And from the stem cells, there are two branches come. One is the myeloid and one is the lymphoid. And then from the myeloid, they divide into platelets, erythrocytes, and other cells of the WBC. So the lymphoid cells, only the natural killer cells, then beta lymphocyte, T lymphocytes, and plasma cells.
Monocyte is included in the myeloid.
Yes, that's what I'm telling. Except the lymphocytes, from the white blood cells, natural killer cells, and plasma cells. They are only in the lymphoid origin, which is the immune system. But the other cells from the WBC, lymphocytes even is the part of the WBC, but they go in the different lineage. And born from the myeloid, there is a megakaryocyte from where the platelet generates.
Yeah.
But megakaryocytes is from the myeloid origin also.
Myeloid.
It's from the megakaryocytes, ultimately the thrombocytes generates. Okay, good.
Yes, ma'am. Okay, next one is what happens per blood smear during staining if the buffer pH is too alkaline, it's blue.
Good.
Slide appears too blue. How long does the average cell, red blood cells, remain in circulation? It's 100. You have highlighted it, ma'am. 120 days.
That's so easy answer. I said you guys can do it, so I just let me highlight it.
Yeah,
okay, that is the easiest answer. Yeah.
Yes, ma'am. Physician requests a CBC and a PT-INR. It's a tube collected in order of draw is light blue and EDTA.
CBC and INR, yes, okay.
Yes, ma'am.
Just give me a
CBC and PT-INR.
Yeah.
So light blue and then EDTA.
And the order of roll, yeah. Okay.
Yes, ma'am.
Oh, there are a couple of options. Okay, I didn't know. Okay, delete entire row. Okay. Okay, next.
Next, abnormal hemoglobin molecules for anemia is thalassemia and sickle cell anemia. Two of the above.
Two of the above, yes.
Yeah. You have given the answer for the pH of the blood.
Yeah, okay.
Yeah, type of hemophilia referred to as classic hemophilia is hemophilia A.
Yes, exactly. Yes, right.
Yes, ma'am. And well, this one you have mentioned also, you have given the answer, leukemia, not considered a disorder of hemostasis.
Yeah, because thrombocytopenia, hemophilia, all is related to the blood clotting related, right?
Right.
The leukemia is a different from the related to the WBC. Okay.
Yes, ma'am. This we have a confusion. Recipient receives donor blood cells and 12 hours later begins to experience a fever, pain or lower back pain, nausea, and vomiting. Our
12 hours later.
Is delayed.
Yeah, to me it looks like delayed too. Yeah, because it's 12 hours later, right?
Yes, ma'am.
Yeah.
Yeah. Next one is RBC indices calculation. Hemoglobin over PAC, red blood cells is the MCHC.
Yes, 12 hours later begins to experience. Yeah, that's the late for, yeah. Okay, next one.
Yeah, next one. White blood cell differentiates into plasma. This is a confusion. To begin producing antibodies is B lymphocytes?
Yes.
Okay, ma'am. Thank you. B lymphocytes. Meant by the term form elements is number 1, referring to all 3 types of blood cells. Next one, neutrophilia occurs in which of the following when a patient is experiencing a bacterial
infection. Yeah, neutrophilia. Yeah. Bacteria is neutrophil and viral is lymphocytes. Okay.
Right.
Okay.
What is the condition where there is normal to increase red blood cells and production but early erythrocytopenia due to continued destruction of erythrocytes, hemolytic anemia.
Exactly. Okay. Good.
Purpose of cross-matching in TMS, determine donor and recipient compatibility.
Okay.
Yes, match the hematology term. We fill it out. Pale in color is hypochromia or hypochromic. Immature erythrocyte, reticulocyte. Variation in size, anisocytosis. All blood cell lines are decreased, pancytopenia, excessive basophil production, basophilia, an immature form of a neutrophil is the band cells.
Band cells or myelocyte? Any one of
or
them.
myelocytes. Okay.
Myelocyte, yeah. You see the in the top they give that option. They didn't give the band cell. Remember? That's why I told
Yes,
you.
ma'am.
Yeah. Metamyelocytes. So yeah,
Meta.
Okay, yeah. Copy.
Each of the following tests is not performed on whole blood donations. The hepatitis A virus.
Yeah. Metamyelocytes.
Which tests are performed on whole blood donations? We have a couple here. We have the hepatitis B surface antigen, hepatitis C virus,
yeah,
the syphilis, HIV,
yeah,
HTLV,
yeah.
yes, ma'am, West Nile virus, and Chagas disease.
Human T-cell lymphomic virus.
Yes, ma'am, we have that. We have
Okay,
that too.
okay, already. Chagas disease, yes.
Yes,
So
ma'am.
that is in the
human
low
too.
in your list, right?
Yes, ma'am. We have that. It's
Yeah.
yeah. Fill in the blank. Anemia is a condition where you lack healthy.
I gave you this option, this question. They may give you one options or something like that, so you can have to remember, okay?
Okay, ma'am.
So they may give you one or two options, or they may be maybe mix with some other things, but you have to know which are so that you can answer it, okay?
Okay, ma'am.
Okay. Okay.
Anemia is a condition where lack of RBCs.
Okay.
Yeah. Type of damage or disorder to activate the intrinsic pathway is vascular injury.
Yeah, intrinsic is vascular, external is tissue. Yeah, external tissue injury. Yeah, good.
Yes.
Okay.
Okay, ma'am. Blood type is known as universal recipient is AB pos. Next, warfarin anticoagulant is monitored by PT-INR. PT/INR. The donors RBCs are mixed in a tube. MLT gently mixes the tube and notices clumping. It's not a compatible cross-match. No.
No. Yeah. Okay. Yeah. Then it should not be agglutinate. Yes.
Yes, ma'am. pH of the buffer used in rights is 6.4, slightly acidic.
Yep.
That's ma'am, yeah. Next one, what may be the cause of stain precipitate appearing on a stained peripheral blood smear? Requires refiltering.
Refiltering because stains
Yes,
has
ma'am.
been precipitated down. Yeah.
Yes,
Okay.
Okay. Type of blood transfusion. This we have also confusion. Most common. So the most common is autograph. Still.
Yeah, to me, it looks like autograph. Most common,
Okay,
but
ma'am.
yeah, it's for me, but we'll see the answer there. Yeah, to me, it's autograph.
It's
If
not
there is
autograph, right? It's autograph.
Not alone?
Autograph.
Not
Autograph.
autograph.
Confused about the terms. They use
Yeah, we have confusion here yesterday.
Transplantation.
Because it's it
Because
said
transplantation
most common. It
movement
said
of blood. Transplantation is where we have all this autographed, isograph, and all of that.
Yeah, but we if you go to the PowerPoint, there is in the blood donation, there is two slides on this grafting. So yeah, blood donation. That's when you are doing the same to twins, same to from the different person, and from xenograft, autograft, allograft, all these things. So If it is possible, autograph is fine. If not, then you can do the others. Yes, tell me, Amina.
So the autograft is the most successful, but the allograft isn't the allograft is the most common?
It looks like that I'm telling. If there is an option, autograph is fine, but allograft is most common. We can tell it's very confusing question. So
True.
yeah, it's very confusing question. They should not give this type of option, but yeah, xenograph no way, isograph is not possible. Autograph and allograph. Allograph, because it's not easy to get autograph always from the using the same thing. So
Yes.
most common should be the allograph. Let us make it 2 and we'll see what D12 says, okay? Because
Okay, ma'am.
that is the D12, whatever they answer, and then we can argue with them. Okay.
Yeah. So next one is considered as a supravital stain is the new methylene blue.
Yeah. Okay.
Yeah. Next one. Which of the following terms is defined incorrectly? It's the anemia, increased RBC count.
What happens in anemia?
Sorry, ma'am?
What happens in anemia?
We have low RBCs or low hemoglobin
Decrease.
count.
Decrease RBC.
Decrease.
Yes,
Yeah.
ma'am.
Okay.
Okay, hematocrit can be measured. Need to happen to the blood first. We use centrifuge.
Yes, you have to centrifuge.
Yes, ma'am.
So that you can get the proper packed cell volume, right? Yeah.
That's right, ma'am. Next one is a CBC analyzer resulted in neutrophil absolute of 0.4 times 10 to the 9 per liter of blood. Would say that we have confusion here too, ma'am. Nah, my answer is critically low.
Critical low value.
Yeah.
Because it's not, yeah, it's not due to, you cannot say this is the neutrophil is not related to allergic. Shift in the body
Right.
is not related to the neutrophil. Normal, this is not a normal value of neutrophil. So you have to rule out in this way. So this is the critically low value. Okay.
Okay, ma'am, thanks. Reason for blood transfusion is to restore adequate blood volume.
Yeah.
Buffy
next
coat
one.
isolated, centrifugation.
100%. Okay.
Yes, ma'am. Manual WBC differential required when the analyzer flags an abnormal automated result.
Mm-hmm.
Okay. We have what's this? Definition of thrombolysis. It's you have the answer. I have also the answer for hemostasis and the purpose of INR, function of fibrinogen. This is a confusion also. Amina has some insight about the erythropoiesis in a 7-month-old fetus occurs in the following.
In
the liver.
Liver and bone marrow. Right?
Thank you, ma'am. Yeah, that's yeah.
Yeah.
Letter
It's
F. A and C. Right stain is a type of polychromatic stain known as Romanowski.
Why is polychromatic?
Right stain, ma'am, is a type of polychromatic
Why is
stain.
polychromatic? Why is polychromatic stain?
Different colors.
Use two dyes, eosin and it used two dyes. That's why it's polychromatic. Monochromatic only, yeah, new methylene blue, supraparietal stain, that is monochromatic because it's only new methylene blue. But here they use, here is the two dyes, so that's the polychromatic.
Yes,
okay.
ma'am. So that's the answer is Romanowski stain.
Yeah.
And next one, we have confusion here too. Phlebotomy using a lavender tube is processed for ESR within, asking for the time and temperature.
Yeah. Yeah. Within
time and temperature, ma'am.
Yeah.
So within 2 hours at room temperature.
Yeah, it's an ambient temperature or room temperature. Okay.
Okay, ma'am.
He said the ambient temperature because if the room temperature is low or high, So that's it, is the ambient temperature. Suitable
Ambient,
temperature.
okay.
Yeah.
Thank you.
If there is
So just-
option room temperature, 2 hours in room temperature, so you can give that option if they doesn't have the option of 2 hours in ambient temperature.
Yes, ma'am. Thank you.
Okay.
Okay, the dye used to stain reticulocyte stain is the new methylene blue.
Yeah, new
Reticulocyte
methylene blue and
stain.
two yeah.
Or maybe if there's a choice of supravital stain, we will also choose that.
Yeah, and if they ask you what is stains, it stains the nuclear fragrance. Okay.
Okay, ma'am.
That's you can write it down. New methylene
Nuclear
blue.
fragrance.
Okay.
Yeah.
Yeah.
Next
you just,
one is stain used to identify immature erythrocyte is the reticulocyte stain.
What is that stain?
The stain used to identify immature erythrocytes. Our answer is reticulocyte stain.
The stain used to identify immature is a supravital stain.
Supravital.
It's telling you the immature erythrocyte. That is the reticulocyte. What is the name of the stain? Not the reticulocyte. What is stain? It says the stain used to identify. What is the name of the stain? So it's a supravital stain.
Oh, okay, ma'am. Thank you.
Or new methylene blue or supravital, which is comes.
Yes, ma'am. Okay, thanks. This one we have a confusion also. Increase in ESR is noted in the following: inflammation, pregnancy, hemolysis, cold blood.
No, it's A, B, and C.
A, B, and C.
In cold blood, it is going to be slow.
Yes, ma'am. Actually, this
There
is my
will be
answer,
no
ma'am.
increase. This will be slow because it's cold, right?
Yes, that's right.
It will be
It
slow.
will be slow.
So yeah.
Yeah. So A, B, and C.
Yes.
Letter F. Next is the most abundant immunoglobulin is the gamma, IgG.
IgG, yeah.
Yes. Precursor cell common to all blood types is the pluripotent stem cell.
Yes.
Granulocytes produced in adults are red bone marrow. Same thing with decrease in erythropoiesis due to an abnormality in the breakdown of stem cells happens in the bone marrow also. Spongy bone of the bone marrow.
Just give me a second. It decrease in the erythrocytes due to an abnormality in breakdown of the stem cells happens in aplastic anemia.
Aplastic anemia.
Oh. Okay, ma'am. Thanks.
Okay.
Next is the erythropoiesis production is regulated by what hormonal substance is the erythropoietin? Okay, ma'am. A condition where there is normal to increase hematopoiesis but early erythropenia due to early destruction of erythrocytes, hemolytic anemia.
Exactly.
Right, thank you, ma'am. Erythropenia or erythrocytopenia, blank decreased numbers of RBCs in the blood. Yes, ma'am. A mature neutrophil is known as Ban neutrophils
Or metamyelocyte or
metamyelocyte.
metamyelocyte. Okay. Yeah.
Okay, ma'am.
What about the option? Yeah.
Yeah. This is the one that we have discussion earlier. Clotting disease or disorder, where all blood clotting factors are used
Yeah.
up.
So what is called DIC, right? Yeah.
DIC, yes, ma'am.
Yeah. DIC. Yeah.
DIC.
Yeah.
So the lavender purple tap vacuum thinner tube will be used for which test? So we have CBC, EFT, platelet count, G6PD, APTT, hemoglobin
Just give me a
electrophoresis.
lavender purple tub will be used for
RBC
which test? Okay. CBC for sure. Platelet count for sure. Hemoglobin electrophoresis for sure. RBC indices and G6PD also you can use it, but at the same time you can use for the chemistry also. Yeah, G6PD sometimes we use it. Yes, okay, good.
So Yes, ma'am. This osmotic fragility is in mint green, and these are the two excluded: APTT and osmotic fragility.
APTT is an INR, osmotic fragility is mint.
Yeah.
Yeah.
Okay, next is anemia occurring due to bone marrow malfunction is
We
aplastic
already
anemia.
give the, yeah, we already
Yes,
give
ma'am.
in a writing form, yeah.
Yeah. Blood cell has no nucleus, RBCs or erythrocytes.
And?
Reticulocytes too.
No.
And
platelets.
Platelets.
Yeah. So if we have the combination
If there is
of,
only one option, you can give the erythrocytes. If there is a platelet and erythrocyte slash, you can give that one. If give the platelets only, no erythrocytes, platelets, WBC kind of like that, then is a platelet, okay?
Okay, ma'am, thanks.
What the question will come, you have to answer accordingly. But these two cells doesn't have the nucleus.
Right. Okay, the normal erythrocyte characterized by specific shape, which is the biconcave disc. And fill in the blanks. Lack of red blood cells. However, you have different answers on this. Results in hemolytic anemia.
G6PD, glucose 6-phosphate dehydrogenase. Lack of
G6PD, okay, ma'am. G6PD deficiency. Okay, neutrophils are predominant and active in bacterial infections. Abnormal hemoglobin S causes RBCs to become sickled. And eosinophils are active in allergic and parasitic infections. Yeah, lymphocytes are predominant and active in viral infections. The failure of the bone marrow to produce RBCs causes aplastic anemia. Lack of vitamin B12 results in pernicious anemia. The two non-granular leukocytes are lymphocytes and monocytes. This we have a confusion. When the WBC count is abnormally high, the physician will most likely request
the differential
count. Thank you, ma'am. Yeah, so that's it. Next one is granulocytes are formed in the bone marrow.
Sorry again, Ms. Mulmul, did you mean like manual differential count?
Yeah.
Generally, yeah, it may be manual or automated, it doesn't matter. But if it's in the automated cell counter, it generally comes with all the differential. But in generally, it happens the doctor sees only is just for testing your knowledge. Okay. If your WBC count is high, that means doctor is thinking there is something. Then doctor needs to know which WBC is high. Whether it's an allergic reaction, whether it's a viral or it's a bacteria. Okay. Or is so that's why they want to do the differential. Yeah. Okay.
But sorry for if we already have the WBC count. We already have the differential as well, right? Because it's already in the CBC count.
Yes, probably.
You can see in the requisition, doctors write CBC and differential.
Right. Correct.
When doctors order that, nowadays in the automated analyzer, everything comes out. But they want to know your knowledge that if, say, for example, you did the CBC, means already blood, erythrocytes, platelets, WBC total. Now the WBC is counted how? What you want to know the next? What is the differential?
I thought that differential is already included in the CBC count.
Not always.
Okay. Okay.
That's why there is a requisition, WBC and differential. You can see in the requisition sometimes it comes CBC with differential.
Okay.
Okay, next one.
Okay, next one. The granulocytes are formed in the bone marrow. Spongy bone of the bone marrow, red bone marrow.
Red bone marrow, yeah.
Yes, ma'am. The clinical significance for the increase of eosinophils in blood is known as eosinophilia.
Yeah.
Okay. Combination of low RBC and high reticulocyte. Letter E, patient has bleeding. Production of erythrocytes in adults occurs. Red bone marrow located in the
Yeah,
spongy
we are
bone.
giving so many times answers.
Yes,
Yeah,
ma'am.
just to make sure. Yeah.
Yeah. Leukocytes that originated from the lymphoid progenitors is letter D, up to 34%. Especially, yeah. B cells and T cells, normal percentage.
Yeah, up to 34%.
To 34 as well. Main function for the thrombocytes, 2 of the above, hemostasis and
Yes,
coagulation.
exactly. Yeah.
Abnormal hemoglobin S is a sickle cell anemia.
Yes.
Analyzing the patient lavender tube for CBC, WBC count is 35, indicative of leukemia.
Yes, it's a high count. Yes.
Yes, ma'am. Leukocyte that phagocytize foreign particles are monocytes.
Leukocytes that phagocytes foreign particles.
Yes, ma'am.
Neutrophils.
That's correct. Monocytes.
Neutrophils
We have a
also does.
confusion here.
Yeah, so monocytes and neutrophils, both there's yeah.
Both.
We'll see whatever the answer, you can do this. If there is only neutrophil absorption, you can do the neutrophils. If there is monocyte is the option, you can get the monocyte, okay?
Okay, ma'am, thanks. The purpose of the diluent when performing a CBC on automated cell counter is letter E. Conductive liquid and spreads the cells to facilitate cell
counting. Good.
Yes, ma'am. Actually, you highlighted already, ma'am. So this is a giveaway for us.
Okay.
Granular leukocytes, letter E also. A, B, and C are correct.
Granules, white blood cells have low nucleus. Okay, yeah.
Plasma makes up, we know this, 55%. Cells make up 45%. Which is not true regarding ABO blood type. Letter C, type B has A antigens on the RBCs.
What antigen it has?
B.
Okay.
B antigen. Buffer solution used with right stain is 6.8.
And I gave you all this
Yes, ma'am,
red
you
color
have.
marks, so I gave you so that you can get a good idea. Okay. Okay.
Yes, ma'am. Buffer solution of right stain, pH 6.8. Slightly,
I
but
think
whatever the
6.4.
question is,
6.4. It's a little bit acidic. 6.4.
Okay. You have also answered this blood transfusion for a patient. And the next one is the characterized by excessive red blood cell loss is hemolytic anemia. You also have given us the answer for neutrophils.
So that's why I told you the neutrophils also in addition to monocyte. Neutrophils can phagocytize bacteria and small pathogens. Yes.
Yeah. Okay.
Okay.
Which type of WBC is responsible for producing T and B cells, lymphocytes? And we have a confusion regarding the proper angle of making a blood smear. D2L is 20 to 35, if I'm not mistaken.
Yeah,
30 degrees angle.
Proper angle is 30 degrees.
30 to 32 degree to my knowledge, but whatever the options is coming, if they give you 30, you can 30. If they give you 32, you can put the 32. But 30 is a good one. 30 to 32 is a good one. Yeah.
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 Whole blood is defibrinated by confusion here.
Glass beads. Glass beads.
Blood. Sorry, ma'am?
Glass beads.
Oh, glass beads.
Yeah, so that the fiber can stuck on the glass beads like a cell, and
Yes,
it can the
ma'am.
fibers defibrinated means you are removing the fibrin.
Right.
Where's the
Okay, blood
what is the autocoagulation problem when the from the most defibrinated, fibrin? So sometimes their bloods are getting defibrinated and then it's going to be put it back again. Defibrinated. Okay. Next
Okay,
one.
blast boots. Next is not considered coagulation test is letter B, PTTA. This you have already given it yesterday. Factor involved in von Willebrand disorder.
Yeah.
8.
Okay. So,
Factor 8.
yep.
Yes, ma'am.
Okay. Okay. Next one.
Type of WBC releases histamine, basophil, and we don't have an answer on this next one. Which series of blood cells do not belong to the leukocyte series? Probably there's some selection, multiple choice on this.
Why I don't know leukocyte series? Leukocyte series. Oh, thrombolytic series. Because those are the platelet. That is the platelet side. Doesn't belong to the leukocytes. It's thrombolytic series. Okay. There may be a couple of options. Yeah. Thrombolytic series. Yeah.
Oh, thrombolytic. Okay.
Yeah. Yeah.
Series.
There may be some
Cytoplasm
more
of
option. Yeah.
Yes, ma'am. Letter D. Large coarse red orange granules for eosinophils. Next one is large purple or purplish block for basophil.
Basophil, right.
Normal circulating blood, the largest blood is monocytes. Nucleus of the lymphocyte is usually blue.
Round. That is the color. What is the shape? Is round.
Oh, nucleus. Oh. They're usually
It's large local.
No, it's not the color. Nucleus of lymphocyte. I'm not sure if it's kidney, like a kidney shape.
It's not like it's large lobulous. I think it's.
Oh, let us see the lymphocytes, how it looks like. No, it's not a lymphocyte doesn't look like the kidney shape. No.
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 The monocyte has that.
Monocyte takes the full portion.
Surround.
Yeah, so let me
almost occupying
No.
small cytoplasm.
Lymphocyte. Let me see the nuclear lymphocyte. No. Lymphocyte nucleus is not always skinny. Mainly it's round. Mainly it's round. Yeah. Monocyte has little bit till kidney shaped, but lymphocyte is fully round. Yeah.
Okay, thanks.
Yeah.
Lifespan of platelets is about 10 days. Normal lifespan of platelets?
10 days.
Yes, ma'am. Thanks. We have a confusion about this. But I think Kara is right. The study of blood.
Yeah, study means hematology. Blood production, blood production is hematology. Yeah.
Yeah. Variation in shape is of erythrocyte is a poikilocytosis. Marked variation in the size, anisocytosis. Increase in size of erythrocytes or macrocytosis. Is it okay also to say megalocytosis, ma'am?
No, macrocytosis. And what is the decrease in size? Microcytosis. Okay.
Yes, ma'am. And you have given us the answer for fibrinogen.
I know.
Yeah. Next one is the basic dye. Is the methylene blue. Sarina is correct.
Yeah.
The hematopoietic stem cell differentiates into A and B. Are correct. Myeloid and lymphoid. Aplastic anemia is B and C. Caused by exposure to ionizing radiation and common disorder of the blood. Typically diagnosed on a complete blood count. Is that correct, ma'am?
Yeah. B and C. Yeah.
Okay, ma'am, thanks.
I was just reading, that's why. Okay, yeah.
Yeah. Components would normally be found in plasma. All are correct.
Yeah, calcium, glucose, cholesterol, fibrinogen. Yes, okay, good.
Yeah. All of the following are types of granular leukocytes except lymphocyte, letter A. Following is true regarding an automated cell counter, answered letter E. All are correct.
Yeah, just I'm reading.
Number.
Oh, yeah, right.
Electronic method.
Okay, next one.
Next one, technician had difficulty finding the vein. Left the tourniquet for 4 minutes. The ESR will be high. We have confusion here, ma'am. Oh yeah, that's also my question.
If the tourniquet left on 4 minutes, that means there will be hemoconcentration. Hemoconcentration means there will be more restless. It will be decreased. Yeah, there will be. Yes, if you put the tourniquet for a long time, what is going to happen? Plasma will be less, more will be, hemoconcentration will be there, right? There will be more cells, more everything. Then when if you put it down, is more things, more dense means it's going to take long time, so it's going to be less value.
Less value.
It's a very concentrated blood. It's going to take long time to get down, right? If it is get down less, means that you are going to reading is going to be less. So that's why it's decreased. To me, analyzing is looks like that. Yeah.
Yes, yeah, that's the question that I usually I'm quite confused with the ESR. Do we have a result that says high? Because the value, the normal value is a 0 to 20 for female and 0 to 15 for male.
Yes, it is in your PowerPoint. Whatever is in the PowerPoint.
Yeah. Is there a such thing as high, ma'am? High value for ESR?
Which one?
For example, like the reading is 40.
Yeah, that's when high
How do we
ESR.
say that?
High
Is that low or
high ESR. High ESR.
High.
Yeah, it settled down high too quick.
Okay,
high
ma'am.
ESR. Yeah.
I'm quite confused there actually.
Yeah, I got it.
So,
Yeah.
okay. Next one is positive reaction in blood grouping is agglutination.
Yes.
This we have a confusion. Increase in non-filterable blood components and a decrease in plasma.
Hemoconcentration. Non-filterable means
Thank
blood
you.
cells. Blood cells.
Yes, ma'am.
All blood cells. And decreases plasma, because if you put it tourniquet or something for a long time, what is going to be? The blood cells volume is going to be too much. Polycythemia vera, due to the RBC too much, there is a more concentration of the blood components. So that is the increase in the non-filterable, means which cannot filter. So plasma is a liquid which can filter. That's the liquid portion. That is the liquid portion. So that's that they make the question a little bit tricky. Yeah.
Exactly.
Yeah, they make the question a little bit tricky. So decrease in the plasma, yeah, blood components will be high and plasma volume will be less. So hemoconcentration.
Thank you. Thank you for that explanation. Yeah, it's quite tricky actually. Next one is blood
That's
grouping.
why maybe you can see there are same answer, but I give you a lot of different questions so that you get used to it.
Yeah. Okay, ma'am. Thanks. Next one, blood grouping reaction with antisera A is positive, antisera B is negative. The blood group is A. You have the answer here also, diluent. Oh yeah, repeated. This we don't have an answer. What cell stage of the RBC development does it completely lose the nuclear fragments?
Mature erythrocytes.
That's the 6th stage, right? We have 6 stages of maturation.
Yeah, because even there is a nucleic fragments, reticulocytes are the nuclear fragments. The mature erythrocytes doesn't have any nuclear things. Mature erythrocytes, everything is stored up from the cell. It's the mature erythrocytes.
Meta erythrocytes.
Mature.
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 Erythrocytes. That's the real red blood cells.
Mature
yes. The last
erythrocytes.
stage.
Okay.
Yeah.
Sorry. I
It's okay.
heard
It's okay.
okay. In making venipuncture of the forearm, which gauge would be most appropriate? We have different answers here, ma'am. 21
What
to
you guys
23.
mostly used? What you guys mostly use?
21.
21. 21. And
Yeah.
typical vein, mostly we use the 21. That's the answer. I use it in the lab, so you guys
Yes.
can keep
Yeah.
the answers. Yeah.
Okay. This we have a confusion again. Viewing the blood film under the first objective lens to use is the
10x.
10x. Yes.
10x.
low power.
Yeah, lower power field 10x. First time you are going to
10x.
4x, you cannot see anything. So 10x. Yeah.
Okay, ma'am. Low power field or 10x.
Yeah.
Okay. Leukocytes are identified in the blood smears using oil immersion.
Yeah.
Yeah. Capillary
Just give
tube
me
used
just
for
give me again.
hematocrit. When venipuncture is done first, is the plain or without anticoagulant, without
The
heparin.
blue capillary
The
tube. Yeah.
blue. Yes,
Yeah.
ma'am. Primary hemostasis is also known as.
We already did that on the hematology 2, so it's a repeat question.
Vasoconstriction.
Yeah.
Yes, ma'am. Yeah. Yeah, you also have the answer for immunology.
Yeah.
Based on
Antigen,
reaction of
antigen,
antibody
antibody.
reaction. Yes, ma'am. INR, and you have given this also, factor 7. Affected by the storage of the specimen in the refrigerator, factor 7. Yeah. I read this too actually last night, ma'am. That's right.
Good.
Yeah.
Very good.
Factor 7. Yeah. HDN is caused by, and you have given the answer, antibody of an Rh negative mom. So increased erythropoiesis is the indication is letter C, 3 to 4% of reticulocytes.
The next one I gave the answer yesterday, heparin.
Yes, ma'am, heparin.
Yeah. Okay.
Yeah.
Good smaller should that was from should not from thin to thick. It should be thick to thin. Okay.
Letter E, yes.
Blood clots. The fluid remains after separation is called
serum.
Next one.
Hemostasis. All are correct. Next one is plasma. It's a repeat actually.
Yeah, yeah.
Yes.
Again, yeah.
This one was given also yesterday by Sarina, if I'm not mistaken. Sedimentation rate increase except the sickle cell.
Yes.
Oh yeah, no, ma'am. You have also you have confirmed that too yesterday.
Yeah, because sickle cell anemia has the different shape of the size of the cell, so it's going to settle down quickly. It's sickle cell, right? It's
yes,
not
ma'am,
the
sickle
same.
cell.
So it's yeah. Okay.
Next one is following could not be considered as a source of error is the use of freshly drawn blood.
Yes, we did that yesterday. Yes.
Yeah.
Except
all the
duties. Yeah,
following.
that one we did yesterday. The count cells in the body fluids. Good.
Yes, ma'am. Count cells in
Next
body
one also
fluid.
you did. I can remember 1 ml in 2 ml light blue tube. Obviously not. INR tube needs to be filled properly. Blood smear remedy action is.
It's a collects 1 ml blood. It's letter A. We reject the sample. For light blue tube.
Next one.
The next one, we have a confusion here. Thin blood smear remedy is letter C.
Thin blood smear. The blood is too much thin, right? So
Yes,
then increase the angle. Now, smaller drop of blood, no, because it's already thin. So it cannot be increased. So decrease the angle of the spider and bigger drop of blood. Increase the angle of the spider and bigger. Increase the angle of the spreader and bigger. It may be either A or B.
A or B?
Yeah. Both,
Okay,
because the
thank you.
blood smear is thin, so we cannot increase or anything. So it needs to be bigger bigger blood. If we increase the angle, it's going to be more. No, decrease the angle and spread the big drop of blood.
Letter B.
That is the most. I think that is the most suitable one. Yeah.
Yes, ma'am. Oh, letter B, ma'am.
Yeah. It to me. Yeah.
Yeah.
Okay.
Next is the it doesn't affect ESR. Is letter C.
Mm-hmm.
Kilo affects Rulo by
Decreasing.
increasing it. Oh yeah, you have answered this one.
Mm-hmm.
And I think we're done. I know not yet. We have 3 more.
Yeah.
Test has an additional calculation to standardize the value is PT against labs from other locations.
Mm-hmm.
Yeah, oh you answered this one.
Mm-hmm.
Considerations for normal values of hemoglobin is age and gender.
Mm-hmm.
And the last one is
What are the two cons? Yeah. Okay. Next one. Yeah.
Yes, ma'am. Patient answer yes to being pregnant in the last 3 months.
We have
during a
answered that
period.
one. Not valid
Yes,
as long.
ma'am.
Okay.
Are not valid anymore.
Yeah. So no long.
Has
Yeah.
to be
Okay.
corrected.
Yeah. Okay.
And thank you for that.
Okay. No
Thank
problem.
you.
You're welcome. So I'm going to join to another meeting. Everybody is okay? All set?
Yes, ma'am.
Alexia,
All
where
set.
are you? Alexia, where are you?
Hi, Miss.
Yeah, why you
Sorry,
go off
just
from the why you go off from the video frequently? You should not.
Sorry, Miss.
Okay. So okay, so it's okay. So everybody is okay. You guys can continue studying. Everything is.
Yes, ma'am.
But you have to remember it. Now you are looking at the review and telling that, okay, right? So you have to see the answer, ask the question and answer in your mind. Then you can understand whatever you are doing the right answer or wrong answer. It's easy to see in the review and just, okay, I am repeating it. But when you have to close the answer and give the answer, read the question, give the answer in your mind, and then check whether you are giving the right answer or not.
Yes, ma'am.
Okay?
Thank you.
Okay. So yeah, I have to join another meeting now. So wish you all good luck. Okay.
Okay, ma'am. Thanks.
Thank you. Thank you, Miss.
Thank you.
Who is doing Rugiato? What you are doing? Asnet, what is Asnet doing?
Asnet is not doing anything. Asnet is listening.
Huh?
Asnet is listening.
The hairdresser? Asnet is in the hairdresser?
I'm listening, Miss.
It looks like you are in hairdresser. If somebody is doing your massage, yeah, hairdresser. Rugiato. I thought first is you. Now you can see your face. No, you are not doing hairdressing. I can see it. Okay, everyone. Good luck. Okay.
Thank you, Miss. Take
Study
care.
hard. It doesn't mean that you are stopping study. Study as I told you.
Yes, Miss.
Because I know even we do that, when I'll see the results tomorrow, I'll see lot of mistakes. I don't want to see that. I want everyone to get good marks. Okay.
Okay, ma'am. Thank you.
Okay.
Thank you,
No
Miss.
problem. Okay. Okay. So
care.
I
Have
am
a
going
good
to
week.
join another meeting now. Oh my God. I just done like so many meetings.
Very important.
Oh,
Very important person.
no, it's for all instruction, not mine. And I don't like these meetings. These are useless meetings, but you have to join. Rather, I can spend time with you guys. That much better.
Thank
Yeah.
you.
Thank you.
Yeah.
Have a
Okay.
good afternoon, Miss.
Okay.
Resting.
Meeting in general. Join. Where did it send us? Okay. Let me see. Let me close.
Hello, guys. So, page 25, the last question in page 25. I just missed that question. It's folliculocytosis affects Rolex formation by, just want to make sure of the answer. Increasing it?
Yes, increasing it.
Increasing
Letter
it,
B.
right?
Yeah.
Yeah, thank you, Evelyn.
You're welcome.
Hi, guys. I also have a question.
Yes.
On page 3 of the final exam review, question number 2, what is a characteristic of a quality peripheral blood smear? Did anybody get that one?
Let me go. I have to go back to that.
Okay, I missed it.
Is it page 22, Christiana?
Sorry, page 3.
Oh, page 3.
Yeah.
Yeah, hold on. Which one?
What is a characteristic?
It has a nice monolayer.
Oh,
At
has a
the end of
smear,
the
has a nice
Yeah.
monolayer.
Yes, the first one.
Oh,
First
okay. Okay, thank you very much.
You're welcome.
Guys, I have another question too. What is the answer from the erythropoiesis in a 7-month-old fetus occurs in the following? What
It's
is the
both
answer?
bone marrow and the kidney.
Oh, bone marrow. Thank you.
Excuse me, girl. Okay. For the review 2, the first page on review 2. What platelets release a sticky substance to help blood clot? The substance is it fibrin?
VWF, von Willebrand factor.
The sticky substance is the VWF, right?
Yes, yes.
Okay, thank you very much.
Gente, have the married play can also.
Guys, it's Bassinet. Okay, bye. Good luck for tomorrow. I gotta go, okay?
Okay, bye, Asinit.
Bye. Take care. Bye.
Okay, bye everyone. Have a good day.
Bye,
Good luck
Christiana.
tomorrow.
Bye, everyone.
Have a good day.
Bye.
Bye.
Take care.
Take care too, Christiana. I know that's a very stressful one for you today. Yeah?